The committee will come to order. The Ways and Means Committee has been focused on lowering the cost of health care and giving working families more health care options. During a hearing back in May, committee members heard testimony on the benefits of health savings accounts, or HSAs, for families. HSAs allow and encourage individuals and families to save money to cover current and future health care expenses, like co-payments for medical services as well as over-the-counter and prescription drugs. We also learned during that hearing that more should be done to increase the number of folks who are eligible to set up these tax-advantaged accounts and remove unnecessary regulatory red tape to make them even more useful. This effort is in line with the committee's focus on helping working families. In fact, 78% of HSAs are used by taxpayers making less than $100,000 a year. We have before us two pieces of legislation to improve health savings accounts. Today's legislation pursues two avenues of reform. One, to expand the eligibility of those wishing to establish and contribute to an HSA, and the other, to address outdated barriers and red tape harming participation. Currently, veterans receiving care through the VA and working seniors on Medicare are either ineligible or face roadblocks in contributing to these accounts that would help them have more control over their health care. The same is true for Native Americans receiving care through the Indian Health Services and those covered by certain ACA plans. At the same time, various types of care, including direct primary care services, care delivered at a person's place of work, and services rendered just before establishing an HSA, are ineligible to be paid for using health savings account funds. We also know more can be done for patients who need access to mental health and home care services while still contributing to HSAs. In addition to expanding eligibility, we should align annual HSA contribution limits to equal what patients may owe in total out-of-pocket expenses and their deductible. These limits have not been updated in 17 years, while medical costs have gone up 75% during that same time period. The point of these savings is to help folks afford the side of healthcare cost they must cover. So there's no reason to cap that below what they may be required to owe. Under current law, individuals nearing retirement can increase their HSA contributions in order to catch up and better save for health expenses. However, for spouses who want to combine forces on saving for future healthcare expenses, they must open up and contribute catch-up funds into separate HSA accounts. It's needless, and we should end that requirement so that they can easily contribute into the same account. Along the same lines, if your spouse has a flexible spending arrangement, a similar savings vehicle for healthcare expenses, it should not bar you from establishing an HSA. Again, there's no reason to leave these types of marriage penalties in place. The bills before us today would strike that prohibition against establishing an HSA, while at the same time allowing someone who wants to convert their flexible spending accounts into a health savings account to do so. All of these efforts aim to make these savings opportunities more available, more flexible, and more reflective of the reality individuals face in covering their healthcare expenses, all of which will help increase patient access to care. HSAs have a meaningful tax advantage, and I'm proud we're improving these accounts so families can take the most advantage of this investment in their health. I appreciate the bipartisan work that has been done by members of this committee to bring many of these solutions to the table today, and I look forward to us delivering for working families once again. I'm now pleased to recognize the ranking member from Massachusetts, Mr. Neal, for his opening statement.
Thank you, Mr. Chairman. This markup is a lesson in priorities. Mere hours before Republicans either shut down or gut health care services for millions of Americans, veterans, and seniors, we're spending this afternoon marking up two bills that do very little for average Americans. The majority wants to use the day before the most extreme members of their conference make good on their threats to cause a catastrophic government shutdown to double down on unfunded tax breaks for wealthy Americans. This legislation would cost Americans $70 billion just 2 days before millions of women and children will be turned away from food assistance at grocery stores, service members will be forced to work without pay, and law enforcement will be taken off the streets of America. For a group charged with governing, they certainly don't seem to be prioritizing keeping that government open. Days before a devastating government shutdown of the making of a handful of Republicans in the House, they are focused on wealthy Americans rather than working families who will bear the brunt of this shutdown. Expanding HSAs won't expand access to health coverage, nor will it bring down health care costs for the vast majority of Americans. People should know we were interested in finding some common ground. It won't improve the quality of care, reduce the burdens of medical debt, or help those close racial health disparities. Nearly half of the American families do not have enough money in the bank to pay a $1,000 medical bill in the next 30 days, but the legislation before us today will be of little help to them. And as I've said, this is a lesson in priorities. Millions of women and children are at risk of losing food assistance because of our colleagues' disinterest in keeping the government open. And yet here we are today marking up a bill that has very little likelihood of ever becoming law. We know there are priorities we agree on: increasing access to rural health care, taking action on mental health, combating the opioid crisis, to name a few opportunities for agreement. Instead of working together on ideas that could actually be implemented, as we've discussed on a bipartisan basis at a recent markup, our Republican colleagues are doubling down on their historic record of the most unproductive Congress in recent memory. The bill is full of recycled ideas that didn't become law the last time they were brought up and certainly won't become law now, headed into the same languishing fate of the GOP tax plan 2.0. Today, Ways and Means Republicans will vote to skyrocket the debt by $70 billion. Big corporations will benefit. Tomorrow, they will return to the party line of slashing food assistance for children and seniors, gutting veterans' health care, firing teachers and law enforcement officers as they allow the most extreme members of their caucus to throw our government into chaos. It did not have to be that way. I know there are many members of this committee on both sides that object to what is about to happen, but that's not the reality. I hope that we can keep the government open. I hope that there will be some acquiescence on the part of the extreme members of the Republican Party who have brought about this challenge. And with that, Mr. Chairman, let me yield back the balance of my time.
Thank you. I would like to just remind the committee that appropriations and government funding left our committee in 1865. More than 150 years ago, we're not the Appropriations Committee, we are the Ways and Means Committee.
Mr. Chairman.
Ranking member.
By what I've witnessed, I think we should reclaim that responsibility.
I don't know if I want that responsibility. Well said. We might reclaim energy and commerce while we're at it as well. So,
I think there's a motion.
Our first order of business is H.R. 5688, the Bipartisan HSA Improvement Act of 2023. I'm pleased to recognize the gentleman from Pennsylvania, Mr. Smucker, for an opening statement.
Thank you, Mr. Chairman, for yielding and for bringing forward this legislation today. And to the ranking member's comments, I would agree with his last comment, and also understand the concerns about government shutdown. But I can tell you with certainty that there's not one member of the Ways and Means Committee, Democrat or Republican, who's advocating or hoping for a shutdown, and we hope to see that resolved as well. And I can also tell the ranking member and everyone here that this is an important bill, and provisions of this bill are both supported by both sides of the aisle. So I hope that we have some unanimous support for this. Certainly, it will help many people to access health care in a way that they can, and to help make it more affordable. I want to thank the chairman for the opportunity to co-introduce this bill, and I'm doing so with my friend from Oregon, Mr. Blumenauer. But the package consists of 4 separate policies, bills that have been introduced by various members of Ways and Means Committee in regards to health savings accounts, or HSAs. And just quickly, HSAs are a type of personal savings account that individuals enrolled in a high deductible health plan can use to pay for their eligible out-of-pocket medical expenses. They have substantial tax advantages, saving patients money and giving them more choice and control over their health care. And roughly 35 million Americans contribute to and utilize HSAs. That's about 1 in 10 Americans doing so today. And while these accounts have been successful in empowering patients, outdated regulations and red tape still stand in the way at times. And that's why we're here today, just simply to improve what we believe is important provision for health care and important legislation. The first section includes my bipartisan policy along with Mr. Blumenauer, which is the Primary Care Enhancement Act, which makes HSAs compatible with direct primary care, or DPC. DPC is a method of primary care that I've heard from my constituents that allows patients to pay a simple monthly membership fee to their doctor for a range of primary care services. That system provides patients with a convenient and affordable way to receive those basic health care services. There's a lot of data to support this. It proves that the benefits of this whole person, it's a whole person and all-inclusive care. And in fact, DPC patients have been shown to spend about 30% less on their health care. DPC doctors spend much more time with their patients, which they love, up to 4 times more than their non-DPC counterparts, by the way. One study have found that DPC members experience 40% fewer ER visits. They tend to get treatment earlier, and also 25% fewer hospitalizations. Current IRS rules consider DPC agreements as incompatible with HSAs. So this bill is very simple. It would allow expenses for DPC, that monthly fee, to be included as an eligible expense to be covered with HSAs. So this would correct the provision that's currently there and would help additional Americans to access DPC through HSAs. Mr. Chairman, I ask unanimous consent. I'd like to insert into the policy records of various organizations that support this policy, including the Corporate Healthcare Coalition, the ERISA Industry Committee, the Employers Council on Flexible Compensation, the Americans Benefit Council, and others. So I'd like to...
Without objection.
And then as well, I have a unanimous, asking for unanimous consent to insert into the record a 2022 report of the Society of Actuaries that demonstrates that enrollment in DPC is associated with a reduction in overall demand for health care services outside of DPC.
Without objection, so ordered.
Thank you, Mr. Chairman. The second policy, or the bill in this package, will allow individuals with HSAs to utilize discounted health care services at clinics on their worksite. And this policy was championed by my colleagues, Mr. Wenstrup, Ms. Sewell, Mr. Kelly, and Mr. Blumenauer. And currently, the IRS views some worksite health care clinic services that's incompatible with HSAs as well. This policy would enable workers to receive health services at their place of employment, leading to more convenient and, again, more accessible care. The third bill, Health Savings for Families Act from Mr. LaHood and Mr. Hearn, allows individuals to maintain an HSA even if the individual's spouse is enrolled in a flexible spending arrangement, or FSA, which is currently prohibited. Patients should not be unfairly banned from using the tax benefits of an HSA simply because of their spouse's FSA, and this policy would correct that. Finally, the last pillar of our package, the Flexible Savings Arrangements for a Healthy, Robust America Act, would allow employees at their employer's discretion to convert their FSA and health reimbursement arrangement balances into an HSA contribution upon enrolling in a qualified HDHP. Grateful to Ms. Steele, Mr. Crenshaw, Ms. Manning, and Mr. Trone for their work on this particular policy. This policy, combined with the others in this package, make it easier for more Americans to utilize HSAs and enjoy the associated tax advantages. This committee is dedicated to reducing health care costs for patients, increasing access to care, and putting patients in charge of their health care dollars. I'm very proud of the work that we're doing today to make those goals a reality. Thank you, Mr. Chairman, I yield back.
I now recognize the ranking member from Massachusetts, Mr. Neal, for his opening statement.
Thank you, Mr. Chairman. Democrats ushered in a new era of health care access that Americans of all ages and walks of life have richly benefited from. Over the last 13 years, we have given millions of Americans more peace of mind, and today we are raising the first generation of Americans who only know life with the Affordable Care Act. All this in the face of constant opposition from our colleagues on the other side who continue to attack the health care system that we much improved. Instead of working across the aisle in constructive solutions, they've unsuccessfully advanced their repeal without replacement agenda over 60 times. Today's two bills are a collection of various provisions that advance triple tax-preferred health savings accounts, which the data from JCT clearly show do not help those average Americans and their families. Americans earning under $60,000 a year receive very little in terms of the benefit from these policies, essentially none. And of course, they are paired with high-deductible health plans. A long-standing body of research shows such plans result in delayed or foregone care, particularly for those who are not wealthy. We should be attempting to address opportunities for people at the lower end. These policies don't lower health care prices, they don't expand health coverage, they just give more to those who are already doing quite well. Let's be clear, this markup is a distraction from the looming extreme Republican shutdown that will fall hardest on working Americans. And yet here we are, with hopes from the majority to advance another policy that benefits the powerful and well-connected. We should be here today lowering health care costs for working families who need it most, not the people at the very top. Let me yield the balance of my time to Mr. Blumenauer.
Thank you. I appreciate the ranking member's courtesy in permitting me to speak on this. It's no secret to members of this committee that I have long been advocating being able to have direct primary care operate successfully without interference from the tax code. Direct primary care arrangements offer individuals access to comprehensive primary care and prevention services in a medical home setting for a flat monthly fee. As opposed to concierge physician services, direct primary care practices typically charge a low monthly fee of $50 to $100 per month and serve low and moderate income patients. These fees support the delivery of high-quality, coordinated care by providing better health care up front in the primary care setting. Well, I don't know that we want to do that. They'll hear me. Yeah. Okay. Thank you very much for the coaching. These fees support the delivery of high-quality, coordinated care by providing better health care up front in the primary care setting. Direct primary care practices reduce unnecessary hospital and specialty care, as well as administrative expenses. I will be talking about this further when my turn comes up, but let me just make the point that we have a tremendous problem in America today in terms of primary care. Most patients get 5 minutes, 6 minutes, 8 minutes when they're visiting with a primary care physician. Direct primary care changes that dynamic. People pay for it on an annualized basis. The physicians are incented to actually talk to the patient. They're relieved from the instant pressure of trying to cycle people through. This is a very important adjustment. Regardless of where people are with some of the other debates, being able to allow primary care physicians to be able to spend appropriate time with the patients, not cycling them through because of a flawed primary care model. This is an important innovation. It has proven to have significant benefits both for the physician and for the patient. And I see this being an area where we ought to be able to come together regardless of difference of opinion in terms of overall approach. This is something that is essential in terms of rewarding value over volume, giving the physician more flexibility, and giving the patient better care. And I appreciate the opportunity to advocate for this, and we'll be talking more closer to the microphone. Thank you very much.
Thank you. The committee will now proceed to consideration of H.R. 5688, the Bipartisan HSA Improvement Act of 2023. Without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance along with a green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of amendment. I will now turn to Tom Bartle, Chief of Staff for the Joint Committee on Taxation, to provide the technical description of the tax provisions in the amendment in the nature of a substitute, with an emphasis on the changes made since introduction. I ask that members hold their questions until after his presentation. Mr. Bartle.
Thank you, Mr. Chairman. The committee members have before them three joint committee documents, JCX 39, 40, and 43, which describe H.R. 5688 and the chairman's amendment in the nature of a substitute and provide the staff's estimates of the budgetary effects. As general background, individuals can contribute to a health savings account only if they have a high-deductible health plan and are not covered under any other health plan that provides benefits covered under the high-deductible health plan. The general policies changed in H.R. 5688 clarify or modify the scope and meaning of that limitation on HSA contributions related to benefits provided that are covered under the high-deductible health plan. And as Mr. Smucker noted, there's also a provision that modifies and restarts the rule that was in effect prior to 2012, permitting conversion and rollover of funds from health spending accounts or health reimbursement arrangements into HSAs. The chairman's amendment in the nature of a substitute provides necessary clerical changes. The provisions are generally effective after 2025, and the staff of the Joint Committee has estimated that the budgetary cost of this legislation would be $12.9 billion for the budget period of fiscal years 2024 through 2033. That concludes my brief summary of the legislation. I'd be happy to answer any questions that the members might have.
Thank you. Are there any technical questions on the amendment of the nature of a substitute? Mr. Doggett.
Thank you very much, Mr. Chairman and Mr. Barthold. You, on this tax expenditure, like all the measures that come before the committee, give us a 10-year window on what the cost is, do you not?
That's correct. The budget period 2024 through 2033 is the current window.
And so if I were to offer legislation that didn't take effect until after that window, some future reform, the score you would produce would be zero.
That's correct, Mr. Doggett.
And so one way to make a bill appear to be less expensive than it really is to defer the date that it becomes effective.
When provisions become effective do affect our estimates.
The total cost of the expenditures that are included in this bill and the next one that we're considering, both of them have a deferral of date, I believe totals up to right at $71 billion, does it not?
Yes, it does, sir.
But the real cost of the bills, if you measured the 10-year period that they're actually in effect, is substantially more than that, is it not?
Well, the figure you cited is the current 10-year period. If you're asking, are the provisions permanent and will there be costs outside that period?
My
That's also
question
true.
is, if you've provided us the answer to the question that we always have, is what's the 10-year score? But if you were to measure the 10-year period from when these two particular bills become effective, instead of this 10 years, it would be a substantially greater figure than $71 billion.
If your question is, were the effective date accelerated yes, the estimated cost would be higher than the $70 billion. Yes, sir.
We really can't tell over a 10-year period from the date that this bill becomes effective 2.5 years from now how much it will cost, because that's not the analysis you normally would do.
That's correct, sir.
Thank you very much.
Mr. Larson is recognized for technical questions.
Thank you, Mr. Chairman, and thank you, Mr. Bartold, as always. I just wanted to explore with you the impact that this legislation might have on Social Security and Medicare trust funds. As I understand it, and correct me if I'm wrong, but when an employer makes a contribution to an employee's HSA, the employee not only does not pay income tax, but also doesn't pay the payroll tax. Is that correct?
Mr. Larson, that's correct. On the employer's contribution, there is no payroll tax.
Additionally, when an employer makes a contribution to the employee's HSA, not only does the employee not pay the payroll tax, but the employer also doesn't pay the payroll tax. Is that correct?
That's correct, Mr. Larson.
And now the payroll tax is important, as we all know, because the payroll tax is how we fund Social Security and Medicare. Is that not correct?
That's correct. Payroll tax is the primary source of funding for Medicare and Social Security, and the additional income tax on certain Social Security benefits for higher income individuals.
And as I look at the tables that the Joint Committee on Taxation supplied for this legislation, where would I find the effect on Social Security trust funds?
The Joint Committee staff routinely reports the effect of the payroll taxes on the trust funds as off-budget revenue items, and we report they're part of the total revenue estimate. We break that out from on-budget and off-budget, and that's reported in the footnotes to the tables. So each of the tables for the legislation under consideration today has footnotes that detail the off-budget effects. Those are the payroll tax effects.
So when we look at the off-budget items and when we total those up, I come to $18.4 billion. Does that sound right to you?
For the legislation that we have before us presently, Mr. Larson, H.R. 5688, it's $3.4 billion.
Well, if you add both pieces of legislation, when I look at the tables.
If I look ahead to the next bill under consideration, the off-budget effects in that legislation total about 15 billion, so it would be about 18.4 in total for the two bills. Yes, sir.
So if I'm correct in looking at both bills again, and thank you for correcting me with regard to that, I'll let the record show that just over the next decade, these bills will cause a loss of $18.4 billion to the Social Security Trust Fund. With that, I yield back. Yes.
And given the way the true cost of this bill has been hidden in a very deceptive way by delaying it 2.5 years, unlike what we've done with HSAs in the past, that cost actually is much higher than that.
That's correct. And as the chairman pointed out in his opening statement, said that we haven't tackled this issue in 17 years. It's been 52 years since Congress has done anything to enhance Social Security. We have over 5 million fellow Americans that get below poverty level checks in all of your districts from Social Security, below poverty level. And here we are today, amidst a government shutdown, talking yet again about how to provide the wealthiest amongst us with another tax break, while your fellow citizens get below poverty level checks. I yield back.
Mr. Kelly is recognized.
Thank you, Chairman. being one of those people that offers health care plans for the people that I work with every day, and then told, wait, you see what you're doing now, you're avoiding paying tax. I got to tell you, it's amazing to me, and I don't mean to be in any way disrespectful, but if you've never had payroll, if you've never had to take care of people, if you've never actually had to take a look at your cost of operation and then try to provide a benefit for those people that come in every day to work with you to be successful, to help them be successful, I am amazed sometimes. But I want to be clear, Mr. Barthel, when we say cost, what is that referring to? It cost whom?
This is a reduction in receipts to the federal treasury.
Okay.
And it's measured relative to the baseline projection of receipts in the absence of the legislative changes.
Yeah, so what we're saying is anything that we call cost is a cost to the treasury. Is that right?
It's a reduction in receipts that would have been received.
It's revenue.
by the
It's
treasury.
revenue.
Yes, it's revenue.
Right? So anytime we say cost on here, make sure that people understand the revenue is that we've allowed taxpayers to actually do something and made it possible for them to make a decision what's in their best interest, as opposed to buying into something that is $33 trillion plus in debt. And we're worried about the cost of that. And these son of a bees that make this available for those people that work with them every day, to give them some type of a benefit? Who the hell came up with this program? The Social Security, by the way, it's never put in a lockbox. All we put in there is a slip saying we owe you this. Wouldn't it be nice if you knew that, and I kind of really, I do fear this, but someday we're going to go after savings accounts too, because you shouldn't be allowed to have savings account. Everything we try to do is to find out who's not paying their fair share. And for God's sake, these employers who bring people onto their team and put together a package of benefits, that's just because they can dodge paying taxes. Nobody would ever come to this institution and ask them for advice on how to run their business. Because the only thing we do is tell them, you're not paying enough. And we're going to have real losses, and it's going to be a real cost to the government, because we're allowing the people that actually earn the money to put the money somewhere that they can use in their future. What a horrible, horrible group of people we have out there. This is astounding to me that we let these people get away with this for that long. Mr. Barthel, I really appreciate you, and you know I've had these conversations before. By the way, I got the picture of my dad's graduating class in World War II. You and I have shared these things. I can't tell you how much I appreciate what you do. It must be hard, though, to think that an employer benefit package which helps the people that are on their team is really a tax scam. Really? Really? I got to tell you, if you're in the private sector, and God help you if you haven't been, because I really believe you shouldn't be able to serve in public sector until you've been in the private sector and been fired at least once and worked on a commission-only basis for your income. I hate like hell for people who don't really worry about their paycheck because it's automatic they're going to get it, as opposed to somebody who gets up every day and goes to work to make sure they can feed their family, put a roof over their heads, put clothes on their back, and say, you son of a gun, you don't want to pay your fair share. That package, whether it be health care or some type of a pension program, whoa, you tax scam, you lousy, lousy person, you don't want to pay your fair share. I really wish, and I hope I don't I don't want to insult anybody. I have a bad habit of doing that. I got to learn. You should talk nicer because words do matter. This is a case where we're trying to do something that makes sense for people who work hard every day and give them some type of a benefit. I got to tell you, I've done it all my life, and the best thing for me is whenever somebody's with us and they retire is they come and they thank me and they'll say, you know what, thank God that your father put this pension program. Thank God that you guys had health care for us. Thank God you did this. Now, it was selfish on our part. We wanted the talent to stay healthy. We wanted the talent to stay on the floor, and we wanted them to actually go full term with us. So at the end of their work period with us, they would thank us for being somebody who actually cared about them. And I never, ever in my life, when I looked at health care packages, thought, this is some way I can cheat the federal government. It's a tax scam. Whoa, okay, I'm sorry. I'm out of gas. I'm out of patience. I don't know. I don't know how anybody, if you haven't been in the private sector, gentlemen and ladies, please go there, give it a shot. It's a lot of fun. I yield back, Chairman.
Additional individuals for technical questions. Mr. Thompson.
Thank you, Mr. Chairman. I'll try and be as succinct with my technical question as my friend, Mr. Kelly. Mr. Bartle, you explained to both Mr. Doggett and Mr. Larson that there's a scoring issue with these two bills. Is it correct that the two bills will cost $71 billion?
Mr. Thompson, the legislation currently before you, 5688, we have estimated at $12.9 billion, and our estimate for 5687, which is the next legislation that will be before the committee today, we've estimated at $58.3 billion. So that would be over $70 billion, as you said, sir.
And you explained to Mr. Larson that the loss to the Social Security Trust Fund from the combined legislation would be $18.4 billion?
That's correct, Mr. Thompson, and that's reported in the footnotes of the two tables before the members.
And then you also mentioned, based on Mr. Doggett's questioning, that given the delayed operative provisions, that this number will be more. Can you tell us how much more?
We do not presently have estimates of assuming different effective dates. I interpreted Mr. Doggett's question to say if the effective dates were not for the provisions to be effective after 2025, but perhaps after 2023 or after 2024, we would see effects on revenues being decreased earlier in those earlier years as well, so the total cost would be larger. But we have not made those estimates, so I cannot tell you precisely.
But we can rest assured that the cost will be more than $71 billion, and that the loss to the Social Security Trust Fund will be greater than $18.4 billion.
If the effective dates were earlier than in the present legislation before you, that is correct, sir.
Thank you. And then one final question. How is this bill paid for?
There are no general offsets in this legislation, sir.
So there's no pay for in the legislation.
We have no items on the table with a positive sign, sir.
Thank you. I yield balance my time to Mr. Larson.
Mr. Bartold, thank you, and I always enjoy listening to my colleague, Mr. Kelly. I owned a business of my own as well, and enjoyed making those payroll taxes. But because I knew as an employer that my portion of Social Security I was able to write off, but the employee was then able to receive an unbelievable benefit, and so is the individual. A benefit that gives you both a pension, spousal, dependent, and disability coverage. Having been in the insurance business, anyone who can find me a policy that provides that, and at the rate that it does, there is no better business deal out there, especially for entrepreneurs who just start in the business as well. And in our system where we want to encourage risk, what better safety net? However, Congress is asleep at a wheel in terms of not recognizing what we need to do to enhance and protect the program, not diminish it, as this legislation, unintended or not, will do to the trust fund. Thank you, Mr. Thompson. I yield back.
Mr. Smith.
Thank you, Mr. Larson. I'll just add, I too, Mr. Kelly, own a business and have to deal with all the issues that I'm assuming that you deal with. Yield back.
Mr. Smith is recognized for technical question.
Just for the sake of clarity, if Mr. Larson could update us on the numbers. You characterized a plan that I think suggests some data that I'm not sure is entirely up to date or accurate.
What data are you referring to?
The overall numbers of the program I think you are referencing.
What program would that be?
I'll let you speak for the program you were referencing.
I was referring to the numbers that are going to cost the trust fund that Mr. Bartold provided us the numbers with.
Okay, well, I think that it would serve us well for us to address issues per the needs of various folks across America, rather than thinking any and all solutions need to be government-centric, one size fits all. Let's let the American people decide for themselves more often than we do right now. And I now yield.
We could
my
do
time
that
to
with a
Mr.
vote.
I yield my time to Mr. Kelly.
You could put your plan out, and we could have ours. We could have a vote. That'd be a novel.
Okay, so Mr. Smith yielded me some time. So it's interesting because part of the benefits package that we have at the dealership, every year they come in and they update us as to what the balances look like and how much the gain is and what we're looking at that has grown. Is there any way we could check and see what the actual balance is right now in the Social Security? And I know the government uses it as a piggy bank, but do we have any idea at all what is the actual balance in Social Security, the fund itself, in hard dollars and cents? I don't know if anybody knows that answer. I don't know that there is an answer, because usually the answer is, well, it's going to be based on future revenue that we take in, right? So if I found my bank doing that, I would change banks so quick. We've grown into this idea that somehow Social Security is a great account that we can go into, the government now, not me, I can't go in there, I can put money in, but I have to wait till I retire to take money out and pay tax on it once I take it out. So there is a revenue gain there, is there not, Mr. Barthold? So it's taxable at some point, if you live long enough.
Social Security benefits for certain taxpayers are partially included in income and subject to tax, sir.
Yeah. Well, we want to make sure. We got to get them somewhere along the line. Let's hope they live long enough to pay a lot of tax on it. Can you tell me, is there a balance in Social Security right now that we could go to? If I were to look at my pension account and ask the people that handle that, please tell me where I am today, what was the loss or gain over the last 12 months, and what should I be looking at into the future? Is there any ability to do that in Social Security?
I believe the reports of the chief actuary of Social Security do provide some information along that line, sir, but I do not.
This isn't a gotcha, by the way, because I don't know either. I just know that if I were enrolled in a pension program where I was putting a certain amount of my pay in, I would have the right to actually question what's there. And if it's not being handled the right way and it's not growing, then I would be very surprised to listen, you know what, I think I need to change plans. Now, listen, I'm not taking a knock at anybody, okay? I'm not. I'm just telling you is if you haven't walked that walk, you can't talk that talk. And it's bizarre to me that people who have never been in the private sector develop policy that has no sense in the real world.
Well,
this is an incredible way to run a business. It's an irresponsible thing. We talk about, every time we talk about cost, what you're saying is the cost is to the government because a taxpayer got to keep his or her money. And that is such a bizarre statement. Now, I love this country. I'm never leaving this country. I'm hoping to somehow contribute something along the way. But I really do question, when we look at this, I would be so embarrassed at the end of the year to do our annual meetings with each individual who's enrolled with us and say, you know what, this is what you should have in there, but we needed it for something else. The front-end machine wasn't working real well, so we put it in there. But don't worry, we'll put it back when you're ready to retire. I'm going to yield back, but I'll tell you what. I don't know when we're going to wake up to the situation we're in. I've never seen a business so poorly run, and please, I don't want anybody to take a thing that I'm taking a knock at you. I really do believe There's something up in where I live that's called the spotted lanternfly, and we say, well, that's an invasive species, and they also have this Asian carpet boy, that's an invasive species. The most invasive species that Americans face right now is our own government. They just can't keep their nose or hands off of anything.
The gentleman
it is
yield?
Really, no, I can't yield. No, John, I can't yield because this is
You're
so
out of
bizarre.
time. That's why you-
And, oh, good, I'm glad I'm out of
Yes.
time. But you know what, I'm out of time, but I haven't lost my passion to make sure that I'm taking care of the people that provide every single penny for this operation. That's hardworking American taxpayers. Thank you.
Ms. Moore is recognized.
Thank you so much. I have a technical question for Mr. Bartold. I was looking at a document that may or may not, you may not have in front of you, but it was prepared by the Center on Budget Policy Priorities, and it shows the distribution, the income distribution of people who use HSAs. And we heard information earlier from the committee chairman that this health care is provided to people who make under $100,000 a year. And if I'm looking at this chart right, that the greatest benefit, whether it's a combination of personal contributions and your employer contributions, it looks like to me that most of the people who benefit from this make $200,000 to $1 million a year under the employer plan, and in terms of individual plans, those people who make $500,000 to $1 million. Am I reading this chart wrong?
Ms. Moore, I don't have the particular report in front of me that you're referring to. We can prepare for the committee members some information that we have on the number of HSA participants for tax year 2023, our projections and the number of returns, and some information about the value, and I can provide that distributed by income category to the members.
Well, actually, Mr. Bartold, I am looking at, you might be more familiar with information put together by the Joint Economic Committee. And it looks to me...
The Joint Economic
Joint
Committee
Committee.
isn't us.
No, it's not.
You got them. It's you.
Oh, the Joint,
Okay, so
Joint
look
Committee
at-
on
look at your-
Taxation, all right.
Look at the Joint Committee on Taxation. And help me understand what the income, who benefits from the income distribution? Those people with the HSAs, what is the greatest amount of beneficiaries and what do they earn?
Well, Ms. Moore, in terms of number of beneficiaries, our projections for 2023 is that number of returns will have HSA participants is a little over 21 million, and more than half of those returns will be with incomes of $100,000 or greater. And I can provide this table to which I think you're referring to all the members of the committee, and I'll ask my colleagues to do that, and we'll try and get it to you by the end of the day.
Thank you so much, sir. I yield back, Mr. Chairman.
Thank you. Mr. Winstrup is recognized.
Yeah, well, I would say one thing to go along with Mr. Kelly said is I have run a payroll, and I've also taken care of people, and I've taken care of people with HSAs. So that may be one advantage. You know, we're sitting here talking about payroll tax pays for Medicare, Social Security. Indeed, it does. Indeed, it does. So what you're talking about is working people. Working people get on a payroll, pay into the tax, pay into the government for Medicare, Social Security, and other things. And that's what you're talking about is the true cost that they don't pay as much into the government. You know, it reminds me of George Bailey with Mr. Potter. He's like, the real issue is what you can't get your grubby little hands on. But the bottom line is, you talk about true cost, that's not the true cost. That's not the true cost because you're not looking at the true benefit. It's extremely short-sighted in every way. Because here's the cost. Okay, so if people are making $500,000 to $1 million that have an HSA, those people are working for that. And there's a payroll tax taken out of that. And the last thing you want is for them to be sick and not working. Mr. Bartold, do we have any estimate of all those people that have HSAs? If they no longer had an HSA and they become sick and quit working, what's the cost there to those who want to keep their grubby little hands off of people's income?
Mr. Winstrup, I don't have an estimate.
But you understand where I'm going. I know you don't, but maybe we should look into that and consider it. HSAs, I can tell you, so many people budget with their health care. That usually means they don't go get it. This is an opportunity for people to budget with their health care and to be able to go and get health care because they have a high deductible plan. It allows them to save for that rainy day. It allows them to be prepared for the unexpected, or maybe even the expected, because we all get older, we all develop illnesses and problems sooner or later. You take these people off of payroll because they're not well, and the cost is way more than what you're saying is the cost because a small portion of their check isn't taxed. Use your heads. We need a healthy nation to have a healthy workforce, to have a healthy payroll tax system that can fund the programs, Medicare, Social Security. Follow it all the way through. Don't be so short-sighted that the only thing you're seeing is, oh, that means we get a little bit less money to the government. Well, maybe quit spending so much. It all goes full circle. The value of the healthy human life is not estimated in here. And HSAs arguably, very arguably, help keep people healthy and working. And there's a whole lot more tax they pay than just the small amount they take out for their HSA. Look at the big picture. Use your heads. You're smart people on this committee. Use your heads and do the right thing and think this all the way through. Thank you for answering my question. It would be a number, Mr. Barthold, would be nice to have, because you take away the HSA and take away those workers, see how much revenue is lost then. I yield back.
Mr. Ferguson.
Thank you, Mr. Chairman. Mr. Barthold, and historically, when we make major changes and significant changes to healthcare plans, we try to give employers and health plans a little bit of lead time to make the appropriate changes. How common is it when we do that that actually is the case where we push off the start date of these plans to allow plans to accommodate the changes? Is that something that both sides have done?
Well, we have sometimes given the Internal Revenue Service and Secretary of the Treasury very little time, and other times we have given lead time. I couldn't characterize as being half the time one, half the time the other. Okay. But the committee has made choices in both directions on a number of provisions of law, and in many instances have taken into account the need of the IRS to provide administrative guidance and for taxpayers to understand obligations.
Okay, thank you for that. I want to go back to something that my colleague from Wisconsin was bringing up, Ms. Moore, about you providing I think you said you would provide all members a table of the breakdown of the beneficiaries.
Yes, sir. I was just asking my colleagues to start preparing that table with description.
Okay, thank you. So you said that at least 50% of the participants would have incomes over $100,000. Did I hear that correctly?
Yes, sir.
Okay. So that means that 50% would be under $100,000.
Approximately, sir, yes.
Okay.
Half and half.
And do you recall, or is there any way to get a quick snapshot of how many between 100 to 150,000? And, or does, what I'm trying to get at here is that if you've got a significant number of these folks that are getting these plans that are clearly under $200,000, I just have a hard time classifying that as giving a tax break to the wealthy.
Will the gentleman yield? 'Cause
Just a second, Ms. Moore. I'd like to hear Ms.
okay.
Dr. Ferguson, by our measure, income $100,000 to $200,000 is approximately 1/3 of total participants.
So you're looking at a significant number of people that we would classify as being, working in the middle class.
1/3 in that income group, sir.
Yeah,
Yes.
that's a pretty significant. It's just hard to classify it. So you got a third in that group, but you got half under $100,000.
No.
Approximately, sir.
Yeah.
Yes.
So you're starting to eat up a lot of real estate there. So that's not leaving a whole lot of room for people that are making $1 million a year, $4 million a year, or even if they're a billionaire. Correct. And let me ask you this, based on your vast knowledge of the economy and the consumer, do you think that an HSA, if an individual is making $2 to $3 million a year, or they're worth $1 billion, do you think that a $7,000, roughly $7,000 HSA benefit is going to dramatically affect their behavior? I mean, as chair of, it's your position of joint tax. I mean, as a multi-gazillionaire, does it affect yours? I say that facetiously, sir. Thank you for your service. My point is that we go through this exercise and call it a tax break for the wealthiest, but clearly the major people that this helps are our working families. And
Right.
to the argument on that we're going to cut revenue, if we really look at what needs to happen as it relates to our most important social programs, we've got to get more people into the workforce. We've got to get them working. If doing things like helping more families go to work and incentivizing work puts a lot more folks making money and help and generating revenue for Social Security and Medicare. So if that's the argument, then we really need to do as much as we can to get our fellow Americans back in the workforce. But bottom line, I can't wait to see the report to see that the vast majority of the people that receive this benefit are not millionaires and billionaires. These are hardworking middle-class families that are trying to make it in an environment where we can look at it every year and say healthcare costs have gone through the roof, utilization is not where it should be, and quite candidly, Americans are less healthy now than they were 10 years ago. So if we look at it, we've got a system that's broken, and what we're trying to do is simply say to the American people, keep more of your money to make choices to get through these tough times. With that, Mr. Chairman, I yield back.
Different points about different data.
Well, the gentleman has no more time. Wanted to.
Would someone like to yield you, Mr. Neal?
I yield my time to Ms. Moore.
Ms. Moore?
Thank you so much, and I just want to make sure I'm correct as well, because I do have this document in front of me, and it seems that 67%, I'm talking about money now, not in terms of the number of people, and maybe that's where the misunderstanding comes from, that 67% of the benefit goes to people who make over $200,000 a year. And so I just want to clarify the numbers and to what I was referring. And if you want to take it, like I said before, those people making $100,000 a year or more, then you take the 67% and add 24 to it, that's 1. So that looks like about 80, like 90-something% of the people who benefit, the amount of money. So when we start talking about spending $71 billion, according to these charts, like 90-something% of it goes to the wealthiest people. So I just want to clarify that. And with that, I would yield back to you, Mr. Kildee.
All right.
Oh, Mr. Neal.
Mr. Schweikert.
Thank you, Mr. Chairman. I'll try to do this really quickly, and this is probably a conversation we should have on the side. Okay, so you've had the discussion here on distributional effects, but some odd questions on your modeling. Do you have sophisticated enough models to be able to say, here's some of the health utilization benefits? Here's certain things now going to be paid by the HSA that would not have been paid by a traditional insurer, or the likelihood to see a doctor sooner, or to take on certain health benefits that may have certain cascade positive events. I know that's maybe a little ethereal, but it's actually part of even a couple of our Democrat colleagues, talking about health and utilization.
Mr. Schweikert, those are questions that our models don't presently answer, but my colleagues with colleagues at the Congressional Budget Office are trying to look at the effects of different choices in terms of health outcomes, both short-term and long-term. But those are not part of the current estimates that go into estimates of outlays or estimates of the revenue effects.
Mr. Chairman, Ms. Bertel, just as a side, maybe more appropriate for one of your staff who specializes in sort of health outcomes data. Some of our joint economic economists have spent a big portion of this year, particularly on diabetes, obesity, some of the inputs into some of the terrible health outcomes we're seeing in the United States right now. We might actually have some data on utilization benefits that might help you build, saying, look, here's your cost distribution as was just being discussed, but here may be some of the societal health benefits. So I extend that offer if you'd ever like to have that conversation.
Mr. Schweikert, those are precisely the sorts of questions that the analysts at the Congressional Budget Office and some of my colleagues are looking at. They're probably looking at the same data. If they're not, if your colleagues give me a call, we'll get people in touch with each other.
Mr. Chairman, Ms. Bartlett, let's do that. As you know, in the Joint Economic Report, we did an entire chapter 6 weeks ago on both some of the societal and economic and budgetary benefits of just taking on obesity, and it was remarkable. I mean, we're talking a few trillion over 10. Turns out it was the single biggest cost saver and moral, I think, thing we could do, and it's something we often don't talk about. So there are solutions out there, and I sometimes wish we would have a more universal discussion saying maybe the best thing we do for budget and society is actually through a healthier society. Thank you, Mr. Chairman.
Seeing no further technical questions, we'll move to strike the last word. Mr. Buchanan is recognized.
Thank you, Mr. Chairman. I wanted to echo my friend Mr. Kelly and others. My focus, as always, is someone that's been in business 30 years before I got here. I like sharing that story. We used to pay for the first 20 years. We paid for everything and everybody 100%. I want to focus really on the middle class, people making $100,000 and less, where this could be pretty helpful. I mean, the bottom line is, if you look at the community that I was from, I chaired the chamber there. We had 2,600 businesses. Most of those businesses were 15 employees or less, and a lot of the cost gets pushed to the middle class. What do I mean by that? I said we paid for everything and everybody, but now if you look at a lot of those businesses, many times the employees are having to come out of pocket at least a third, and the premium for four, and some businesses it might be more, $1,500 to $2,000. They're having to pay $500 or $600 out of pocket towards their own insurance. And that's why a lot of people say they're living from week to week, more so than ever. It really is, I think, bankrupting a lot of families, unfortunately, that are in that bracket where they don't get any consideration. Something like this would be helpful and could very well make the difference. But like I said, I'm very, very just with what's happening in inflation. I just remember every year we get to a point where we get the insurance cost back and it's gone up another 15%, especially in the last 5 or 10 years. And a lot of that we pick up, but a lot of that gets pushed to the employees. So my point on this, if this will be something that make a difference, especially I'm not talking about people making 500, I'm talking about people as a family maybe making less than 100. I think it would be something we need to move aggressively in that direction. With that, I yield back.
Mr. Doggett is recognized to strike the last word.
Thank you, Mr. Chairman. Well, today it's the Republicans that are the big spenders. In these two bills, they propose at least $71 billion in tax expenditures, borrowing and adding to the national debt to finance every penny of these billions. And we've learned, because of the deceptive way that they've constructed this bill, different than the way prior HSA bills have been constructed, that it's actually much more than that. So concerned are they about runaway spending. It may be that this committee no longer has control over direct appropriations, but this is a tax expenditure appropriation that is just as real in its impact on the national deficit. And certainly Republicans were very critical of the expenditures that we made through the tax system for the Affordable Care Act. They were tax expenditures. And this is all coming from the same debt busters who are at this very moment threatening to shut down our government this weekend, costing our economy billions of dollars, and threatening our nation's credit, just as they did a few months ago when they threatened the full faith and credit of the United States. Yet they have no problem supporting in this committee today $71 billion, or probably it's really $80, $90, $100 billion in new spending, while they are at the same time over there cutting food assistance, public health dollars, rural broadband, combating the climate crisis, and so much more. And how do they spend these borrowed dollars? Well, they're so concerned about the health of people, they say. Well, why is it only that we have to have healthy, wealthy people? How about the rest of our country? They have not focused on the people who have the greatest health needs. They focused on those who have the greatest need for a new tax shelter. Under the guise of increasing affordability, health savings accounts are really a triple tax advantage, and that's why they want to expand it for the privileged and the well-connected. Individual contributions to an HSA are tax deductible. Contributions that get invested can grow without paying any taxes. And when someone gets to be 65, they can take it all out for whatever they want to use it for, and they don't get taxed on any of it. Instead of expanding HSAs, we should be evaluating their shortcomings and asking whether this expenditure could be better applied in other ways to correct some of the many deficiencies in health care and keep some other people healthy. Though Republicans present this really as one of their alternatives to the Affordable Care Act that they've tried to destroy for more than a decade, in fact, what we have here is a kind of Trump care sabotage that undermines health care. Think about it. If you're in a collision this afternoon on the way home, or your child receives a dreaded diagnosis for a disease, an HSA would barely make a dent in your financial burden for that health care. For the half of Americans who cannot afford a $1,000 emergency, a deductible of up to $15,000 can be insurmountable. And sadly, at the prices that we find today in the emergency room, a $1,000 bill would really be a surprise, surprisingly low. And for the day-to-day care patients have with chronic conditions, HSAs serve as a deterrent to accessing care. Several studies have shown that patients with these high deductible plans skip care, don't adhere to prescriptions, and have lower health care utilization for primary care. 1 in 4 chronic care patients are now skipping necessary medications due to cost. No wonder supporters of HSA here today are telling us they spend less on health care because it's the very way it's structured. For communities of color who've already had disproportionate rates of chronic conditions and report more difficulty accessing health care, health savings accounts are widening disparities. They're not closing them, as Ms. Moore has suggested. African American and Hispanic communities are half as likely to have an HSA. And for those who do invest in an HSA, they have lower balances than their white counterparts. White HSA holders contribute an average of $1,800 a year, while black and Hispanic families contribute about $400 to $500 less. This quickly compounds into even wider gaps over time, which are further exacerbated by white HSA holders investing more of their balances and receiving larger employer contributions. In short, there are so many ways to expand health care access and reduce disparities. This is not one of them. let's save our healthcare system as a whole, not just that for a few. Thank you.
Mr. Estes is recognized.
Well, thank you, Mr. Chairman. Health savings accounts are something I'm particularly passionate about. They give the Kansans I represent control over their health care decisions and can save them money. In fact, there are about 800,000 Kansans who are enrolled today in HSAs. These tax-free accounts can make a difference in a family's ability to afford medicine and health care, and the HSAs stay with the individual regardless of their employment. I've personally experienced the benefit of a health savings account. I remember when I first started using an HSA while I was still Kansas State Treasurer. I did the math, and I couldn't come up with a scenario where switching to an HSA didn't help pay the cost of my family's health care. So I'm pleased that today we're working on two bills that do a lot to improve this critical healthcare tool. These bills expand eligibility to previously ineligible Americans, such as veterans, working seniors, and individuals eligible for Indian Health Services assistance. They also open up HSAs to cover direct primary care services and increase the maximum contribution level. HSAs put patients in control of their health care, not politicians or insurance companies. They can lead to better outcomes as the HSA account holder has new buying power when making decisions about their health, which in turn encourages competition and spurs innovation. This is bipartisan legislation because expanding access to our health care tool is common sense. I fully support this bill and the next HSA bill that we're marking up today, and I hope that it passes with overwhelming bipartisan support today and on the House floor soon. Thank you, Mr. Chairman, and I look forward to seeing the benefits for these HSAs to be available to millions of Americans. I yield back.
Mr. Thompson is recognized.
Thank you, Mr. Chairman. I move to strike the last words. Mr. Chairman, I'll work with anyone to use our tax code to help people get the health care that they need. And I recognize there's a place in our health care system for health savings accounts or high deductible plans. But our primary goal here should be to help Americans get affordable, quality health care that they deserve. These bills don't get us there. Republicans could have worked with us to lower drug prices. Republican governors could expand Medicaid, as over 3/4 of the U.S. governors have already done. And as my friend Mr. Weinstrup said, that's using your head. Instead, as our government careens towards shutdown, with right-wing radicals driving this train, the majority has decided to attack medical research funding, slash funds for mental health and disease preparedness, and undercut public health, while holding a markup here today that primarily benefits the wealthiest among us. Oh, and these bills, as we've heard from our witness today, the bills that we're considering, they're going to cost $71 billion and hit the Social Security Trust Fund at a cost of $18 billion. And as was explained by Mr. Barthold, that price goes up as these continue to be in place. So we're heading towards a shutdown, supposedly because Republicans want to cut spending. Yet here we are considering legislation that will add billions to our deficit. I yield back.
Ms. Tinney is recognized to strike the last word.
Thank you, Mr. Chairman. I move to strike last word. Thank you, Ranking Member. I am very excited to speak in support of the Bipartisan Health Savings Account Improvement Act of 2023, which is an important step to making common sense improvements and fixes to bureaucratic red tape for health savings accounts. Since their creation almost 20 years ago, we have seen how health savings accounts have grown to become an important tool for middle-class Americans to access more affordable health care options and control and may have choices in their own health care dollars. That is why 72 million Americans have health savings accounts and rely on it to pay for their routine medical costs. I'm so pleased that this bipartisan legislation includes the Primary Care Enforcement Act, which I'm happy to co-lead with our colleagues, Congressman Smucker, Blumenauer, and Schneider. Across my district in central and western New York, numerous independent primary care practitioners have been forced to close shop or join with larger networks. These losses for rural patients have resulted in less care and abbreviated appointments, and in some cases, no care. Direct primary care offers another option, a choice, if you will. It allows primary care practitioners to maintain a lower overhead and more dependable income, enabling them to continue serving their communities and patients by simply paying a monthly membership fee to their doctors. Patients can have longer appointments and more access to their doctors with minimal additional out-of-pocket costs. One study revealed that the direct primary care members experienced significantly improved health outcomes, such as 40% fewer emergency room visits than those in traditional health plans, a 54% reduction in emergency room claims costs, and a 25% lower rate in hospital admissions. This is a proven and successful model for care. This legislation will simply make it easier for Americans with health savings accounts to access direct primary care, allowing for further access and innovation in this space. Until this bill, patients' use of HSAs, health savings accounts, was limited to purchasing aspirin or eyeglasses, but not primary care. This is a low-cost fix to help Americans improve health care outcomes and to reduce health care costs. It's time our nation's health care coverage policy recognizes this fact. I urge my colleagues to support this common-sense bipartisan legislation, which gives choice and flexibility to this much-needed sector, especially in rural communities that I represent and my colleagues. I thank you, Mr. Speaker, and I yield back.
Mr. Larson is recognized to strike the last word.
Thank you, Mr. Chairman, and I think this provides us an opportunity here to look at what our priorities are, and I think when you consider being on the verge of a shutdown, although it's good to hear that our colleagues here are working to avoid that, because we should at all costs make sure that we do that. But also in terms of what the impact is, even with well-intended plans, and as Mr. Thompson said, who doesn't want to sit and work and continue to make sure that we're able to provide programs for all people, especially in the area of health care. But again, it's a matter of priority. Here's the reality with regard to that priority. Here's the hard truth. Mr. Schmucker, you seem like a reasonable person, but for Social Security, in terms of what it's going to be hit, there are 164,294 Social Security recipients in your district. 127,000 of them are retirees, 7,000 children, 8,000 plus widows, 4,000 plus spouses, and 17,000 disabled workers. Congress has done nothing to enhance the program that any businessman looking at the benefit that it provides would understand in more than 52 years. As I indicated, 5 million Americans, 5 million of our fellow Americans, most of them, the majority of them women, because they were care providers, worked all their lives and paid into a system and get below poverty level checks. Shouldn't that be a priority of the committee that's responsible for this and putting this forward? And if you got a better idea, for God's sake, put it out there. But let's vote on that. When we look and see the impact that this would have, unintentionally I'm going to assume, but what it would have on the trust fund, on a fund that if Congress does nothing, within 9 years will lose 20% of that benefit. And the Republican Study Committee's call to raise the age to 70, raising the age to 70 is a 21% cut. For every year you raise the age, that's a 7% cut in benefits. I suppose for some, I guess it makes sense that if you're living longer, you should live on less. But for most Americans, for more than 40% of all of our constituents, this is the only benefit that it has. And oh, by the way, we don't have to go back to the Great Crash. Mr. Kelly pointed out that, well, we have to look at these things. Go back to 2008 and 2009 when you saw your 401k become a 101k. During that same time, Social Security never missed a payment that went to all of our constituents. It's the best economic development plan that we have. Mr. Kelly's district, with 178,000 recipients, all of who they receive benefits, they're not going out and buying stock options. They're investing that money right back in the community that they live in to buy their groceries, to pay for the cost of heating and cooling their homes, to go to the pharmacy and get the prescription drugs they need. That's what we're talking about when we're talking about priorities and making sure we're not further damaging a trust fund. And hopefully this committee that has cognizance over Social Security actually has a vote on what we should do to enhance the American people. Let the public know where you stand on this. We're letting them know where we stand on health savings accounts. Why shouldn't they know where we stand on Social Security? I yield back.
Ms. Steele is recognized.
Thank you, Mr. Chairman. I move to strike the last word. I applaud the committee's work to make health savings accounts more accessible for hardworking Americans. Saving every penny for our hardworking taxpayer is a very productive work we do here today. Nearly 72 million Americans are currently covered by an HSA. The average household income of those with HSA is $78,000. And about 1 in 5 Americans in their 30s have an HSA. The Bipartisan HSA Improvement Act includes my bipartisan flexible savings arrangement for a Healthy, Robust America Act, which expands options for Americans seeking to save responsibly for their future health costs. I want to thank my co-lead, Representative Kathy Manning, and our co-sponsors, Congress members Dan Crenshaw, David Trone, Kevin Hearn, and especially Lloyd Smucker for supporting this important piece of legislation. This simple bill will allow Americans to transfer flexible spending account and health reimbursement arrangement contributions into health savings account in connection with establishing coverage under a high-deductible health plan. This will keep workers from losing their saved funds at the end of the year or when switching jobs for future qualified medical expenses. Now workers will be empowered with more choice, and employers will have greater flexibility in healthcare spending from year to year. The current IRS use it or lose it regulations and outdated laws cause all sorts of problems for Americans, forbidding employers from distributing funds into employees' HDHP and HSAs. These policies prevent families and individuals from saving up for future health care costs and incentivize people to spend their excess funds on anything worth buying before it's gone, whether it's stockpiling on a bunch of over-the-counter medicines or spending on co-payments for services that are unnecessary. These policies need modernization, and for the latter, could increase premiums for employer-sponsored health plans. In addition, a study published by the Employee Benefit Research Institute found that more than 40% of workers with an FSA forfeited a portion of the contribution in recent years. On average, employees individually lost between $339 and $408 in unused FSA contributions each year, amounting to $7.2 billion in 2019 and 2020. The other side of the aisle saying that this is a cost. This is not a true cost, but this is taxpayer health care cost savings. We should improve access to health care, and I urge my colleagues to support this bipartisan legislation, and I yield back.
Mr. Blumenauer is recognized.
Thank you, Mr. Chairman. I've enjoyed the wide-ranging discussion we've had here. It touches on many important points that we probably don't spend enough time focusing on. I would like to bring it back to just the narrow bill that I'm involved with, dealing with direct primary care, an important example of successful healthcare delivery innovation that has always enjoyed bipartisan support. The direct primary care arrangements offer individuals access to comprehensive primary care and prevention services in a medical home setting for a flat monthly fee. Pretty simple concept. These fees support the delivery of high-quality coordinated care by providing better health care up front in the primary care setting. The direct primary care practice reduces unnecessary hospital and specialty care as well as administrative expenses. This empowers the doctor-patient relationship and enables providers to resist financial incentives that distort the decision-making promise in primary care. It also affords, and this is critical, it affords the patient more time with the doctor, sometimes an hour per visit, giving the doctor the time to build a true relationship with their patients so they can better understand and address their healthcare needs. By offering a high level of access to primary care physicians, evidence shows direct primary care improves health outcomes and reduces costs. It's critical to focus here. The legislation clarifies that direct primary care is a form of health care, not coverage. For tax purposes, it gets confused. The IRS treats it like insurance. It's not. It is a form of care, not coverage, and allows these patients to keep their health savings account. As more individuals and employers seek to utilize direct primary care delivery model, it's important that an outdated tax barrier not get in the way of patients accessing this successful model of care. When we think about how we can best move forwards in a value-based system, we should be making sure that we don't let small things like this stand in the way of people accessing these services. Now, while there may have philosophical differences about expanding healthcare savings accounts and the role in healthcare, I share those reservations. But I think we should have to contend with the fact that that train has left the station. 30% of the public is involved with this. Reasonable changes to help consumers make the most out of what they already have with employer-sponsored coverage without providing disincentives from seeking better models of care. For employees whose employers offer on-site health care clinics, they shouldn't be penalizing for using them. This is important because these clinics literally meet employees where they are. And we've heard from a number of employers that would like to be able to provide this service in a cost-effective fashion. Another key consumer change made by this bill is to recognize that employees switch jobs over the course of a year. Allowing individuals to streamline the conversion of a medical savings account or flexible savings account or HSA means they won't lose their savings when they change their jobs. That seems eminently miserable to me. These sensible changes allow consumers to make the most of their health savings and benefits. I agree with many of my colleagues that we should spend time and money on a variety of things that will increase access to care and make it more cost-effective. I hope we continue to do this. But in the meantime, this bill is still a modest but important opportunity to improve what we have now. I appreciate people's patience, and I hope we'll be able to focus in a little bit on the narrow aspect of the bill that I am supporting. Thank you, and I yield back.
Thank you. Mr. LaHood is recognized. Strike the last word.
Move to strike the last word. Thank you, Mr. Chairman, for having this hearing today, and I'm pleased that we're having this conversation about this legislation today, which of course is a bipartisan piece of legislation. H.R. 5688, the Bipartisan HSA Improvement Act of 2023, is a culmination of what I believe are sensible policies that help our constituents have more control over health care costs and encourage further participation in HSA plans. HSAs are a helpful tool for individuals in making cost-conscious healthcare decisions that recognize the individual element of healthcare choice as well as the services they receive. I am proud that my bill, the Health Savings for Families Act of 2023, was included in this bipartisan package, and I thank Mr. Smucker and others for that. My legislation would allow individuals to maintain HSA even if the individual spouse is enrolled in a flexible spending arrangement. This allows patients to have more control and choice over their health care dollars. Under current law, FSAs can be used to reimburse expenses for an individual and their spouses and dependents. This eligibility for FSA benefits disqualifies an otherwise eligible FSA enrollee spouse from contributing to an HSA, even when each spouse is covered under a separate health plan. With the cost of family health coverage at a record high and forcing many into plans that cover less and cost more, it is becoming more common for working spouses to be covered under two different health care plans. Families are turning to more flexible options that allow them to save on their health care costs, such as employer-provided health FSAs or by contributing to an HSA. Instead of penalizing families for responsibly managing their money, the Health Savings for Families Act fixes this flaw to allow couples to access health care services and spend their money how they wish. This committee has a responsibility and obligation to tackle the kitchen table issues that our constituents face every day, and this is one of them. As families continue to struggle with the high cost of health care, I'm proud that this committee is taking positive steps to provide more tools to make health care more accessible and affordable. This bill has the pieces necessary to help jumpstart that process. I urge my colleagues to support H.R. 5688, and I yield back, Mr. Chair.
Mr. Davis is recognized to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word. The purpose of the Affordable Care Act was to help the many and the most. That increased access to affordable health insurance for the millions of uninsured and to make health insurance more affordable for those already with coverage. Before the ACA was implemented, health insurance plans varied from state to state and from plan to plan. There were some plans that were very good and some were minimal, depending on each state insurance regulations. Health savings accounts and high deductible health plans are instruments used by consumers in some respects to take tax-advantaged savings accounts to be used to save and pay for reimbursed medical expenses not covered by insurance. The HDHPs are often, but not always, paired with tax-free health savings accounts. Employers tend to offer HSAs eligible and HDHPs as a way to lower their health care spending. These businesses proclaim that this benefit leads to increased consumer engagement in their health care and more awareness of the prices in the health care market. Some analysts have reported that HDHPs do not encourage individuals to make sound decisions and leave them exposed to paying more money by delaying or not having the necessary medical care they need. According to the Joint Committee on Taxation, data indicates that the vast majority of people whose incomes from $100,000 to $1 million based on tax year 2023 returns favors more toward wealthy individuals than the working class wage earners who make from $10,000 to $50,000 annually. The aforementioned HSA plan did very little to help low to middle income families or the uninsured. The Affordable Care Act has created a good foundation to interface and improve our health care delivery system by allowing millions of individuals and families to acquire affordable, quality health care insurance. I thank you, Mr. Chairman, and yield back the balance of my time.
Thank you. I next recognize the gentleman from Ohio, Dr. Winstrip.
Chairman, I move to strike the last word. I want to thank the chairman for convening this important markup today. HSA accounts provide an important option for middle-class families who are looking to manage their health care costs. Fortunately, our tax system currently disincentivizes employers from offering worksite health clinics by prohibiting employees from contributing to an HSA if they also receive supplemental health benefits like those provided at a worksite health clinic at no cost or fair market value. Communities in my home state of Ohio and across the country rely on worksite health clinics for valuable resources that keep people healthier longer by providing interventions and preventative health care. I'm pleased that today we will be including H.R. 5777, the Employee Access to Worksite Health Services Act, in today's markup. This important bipartisan legislation would clarify that accessing services provided through a worksite health clinic does not render an individual ineligible to make pre-tax contributions to their HSA. Worksite clinics offer important benefits to companies and the workers they employ, increasing access to care and keeping Americans healthier longer. I'm proud to partner with the representatives here today from both sides of the aisle to introduce this bill. I appreciate it. Yield back.
Thank you. I now recognize the gentle lady from California, Ms. Sanchez, for 5 minutes.
Thank you, Mr. Chairman. Here we are on the eve of a government shutdown, and we're marking up two pieces of legislation that will expand tax breaks for basically the wealthy. All the while, we're ignoring the severe cuts that you are making to critical health programs in the appropriations bills. They are slashing NIH, they are slashing CDC, the 988 suicide hotline prevention, critical nutrition benefits for children and their moms. And today you want to push legislation that largely benefits wealthy Americans who already have health care coverage. High-deductible health plans were originally created as a short-term plan option, not as a long-term comprehensive plan for middle and low-income Americans. In fact, we've seen over time that these plans do little to improve health disparities in our country. If anything, data has shown that these plans possibly exacerbate existing disparities. Many of the Americans with HDHPs cannot actually afford to contribute to their health savings accounts. That leaves many people out. Black Americans and Latinos actually report more problems paying for needed health care services when they are enrolled in HDHPs than white individuals. And it's no surprise that by far the most common individuals who actually contribute to their HSAs make between $200,000 and $1 million annually, which leaves a heck of a lot of folks out. These bills that are being offered before us today do not expand coverage for Americans who are not insured or for Americans who are underinsured. We are happy to work across the aisle to shore up health care coverage for working American families, as Democrats did in the Inflation Reduction Act in the last Congress. Instead, my colleagues on the Republican side of the aisle want to spend $71 billion, billion with a B, in tax giveaways. There are no offsets for these bills. There are no pay-fors for these bills. If my colleagues on the other side of the aisle insist on runaway spending, I would urge them to invest in critical health programs that you're so intent on slashing by forcing an unnecessary, unproductive, and damaging government shutdown. And with that, I yield back the balance of my time.
Thank you. I now recognize the gentleman from Georgia, Dr. Ferguson, for 5 minutes.
Thank you, Mr. Chairman. And I'm going to get to another point, but I just want to applaud my good friend from Oregon for his efforts to get the patient and the doctor connected. Your description of what should happen when a doctor and a patient get together to provide better care, to have that intimate relationship, to be able to provide the best primary care, I think that's a laudable goal, because we used to have that. We used to have that. And then all of a sudden we got involved in creating an environment where we had the vertical integration of the healthcare delivery system, and quite candidly, independent practices are just going away. And, you know, the unintended consequences of, or maybe the intended consequences in some cases, of the Affordable Care Act is that it destroyed exactly what we're now having to go back and get, which is that doctor-patient relationship. Do we have a perfect system before? No, but certainly one that's a heck of a lot better now, because to his point, Americans now are not utilizing the system in a way that they should. We are not healthier, and our costs are higher. So I applaud your efforts to reconnect the doctor and the patient, because we used to have that, and I'd like to get it back as well. But now I want to shift for just a minute into this discussion we've had about who's receiving these benefits. And we heard from Joint Tax that 50% of the people that receive these benefits made below $100,000, and probably a significant number of those probably made less than there was a big chunk between 100 and 200,000. But if you look at it, and I just want us to be intellectually honest in our discussion about how we do this, and have a really good conversation. But when you say to my friends on the other side that the greatest benefit goes to those making above a certain amount, let's look at the real impact that it has on a family budget, because I think it skews. I'm not sure that it's intentional, but I'm not sure that that's an intellectually honest argument. If you're a family making $75,000 a year and you take full advantage of this, you can put up to 10% of your family's budget away for health care. It's pretty significant. If you're making $350,000 a year, that's about 2% of your income. So the real benefit and the biggest impact, because there's a cap on this is not an unlimited amount for anybody at any income level. You actually get a greater impact if you're in the middle class than if you are in wealth. So let's just get our definitions together. And when we've had this argument about the impact on Social Security and our seniors, it does impact it, particularly in this time. Not necessarily this bill, but what's been going on in our economy. I am sure that my dear colleague, Mr. Larson, would be happy to remind me of the number of Social Security beneficiaries that are in the 3rd Congressional District of Georgia. I'm sure I can give him 2 seconds, and he'll probably remind me of that exact number. But I also represent a whole lot of other families in that district, 780,000 people, and every single one of them has seen their quality of life diminished by this economy. Inflation has ravaged every single family. It has been hard, not just my seniors. This economy has really crushed the middle class. Every single family feels the impact of higher energy bills. Every family feels the impact of higher gas prices. Every family feels the impact of higher groceries. It goes across the board. To say that inflation is under control with the exception of groceries and gas is like saying the house ain't, is quit burning down except the back half of it. It just simply is having an impact. So it's not just our seniors, but if we really, really want to talk about our seniors, let's talk about the rest of the people that we represent and recognize that Bidenomics is crushing their ability to advance in life. With that, Mr. Chairman, I yield back.
Thank you. I now recognize the gentle lady from Alabama, Ms. Sewell, for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. I am a committed co-sponsor of the Employee Access to Worksite Health Services Act. Last Congress, I led this legislation along with my colleague, Representative Winstrip. Our bill protects employees' access to health care at their workplace health centers by correcting a provision in the tax code that disincentivizes employers from offering worksite health clinics. Workers in Alabama and across this country will rely on their employers' worksite health clinics to access critical health services. Many manufacturers in my district, including paper mills I've visited in my rural areas, offer worksite health clinics that my constituents go to for intervention as well as preventative care. We must ensure that our tax code incentivizes employers to make these clinics available to all of their employees. In 2021, more than 60% of large companies offered worksite health clinics, which provide preventive and primary care, wellness services, and care for those with chronic conditions. Our bill clarifies that accessing services provided through a worksite does not render an individual ineligible to make pre-tax contributions to their HSAs. It's an important policy, and I hope that we can work together to get it across the finish line. For me, this bill and this part of the bill will increase access to health care by encouraging on-site health clinics. While I'm glad that our bill is advancing today, I do share the ranking member's concern that the backdrop is a Republican-released budget reconciliation and resolution that rolls back ACA coverage, that has higher premium tax credits and prescription savings that many of my constituents rely on. They are demanding extreme cuts to critical programs in exchange for keeping the government open. In Alabama alone, more than 110,000 women and children may lose access to food assistance as a result of a looming Republican shutdown. While HSAs are an effective tool in helping people afford medical services, they are simply not a substitute for the programs ACA coverage offers. I appreciate the working relationship that Representative Winstrip and I have developed over the years, especially on this particular legislation, the Employee Access to Worksite Health Services. We both represent rural constituencies, and we've been able to harness those similarities to advance policies that benefit the communities we both represent. I look forward to our continued efforts on this policy, and I yield back the balance of my time.
Thank you. I now recognize the gentle lady from West Virginia, Ms. Miller, for 5 minutes.
Thank you. Mr. Leader, I move to strike the last word. I want to take a brief moment to highlight the value of direct primary care and voice the support for the Primary Care Enhancement Act that is a part of this package of bills. Direct primary care helps provide quality care at lower costs and allows patients access primary, preventive, and chronic care management for a flat fee. I'm encouraged that in my home state of West Virginia, we have passed legislation which defines direct primary care as a medical service and not a health insurance plan, which helps increase access for patients. The Primary Care Enhancement Act will allow the individuals with high deductible health savings account the choice to enroll in direct primary care arrangements which will help patients gain more autonomy over their own health care dollars. I thank Representatives Smucker and Blumenauer for their leadership on this issue, and I look forward to passing this provision and this whole package out of committee and continuing to provide flexibility in health care for individuals across the country. Thank you, and I yield back.
Thank you. I now recognize the gentle lady from the state of Washington, Ms. Del Bene.
Thank you, Mr. Chairman. I move to strike the last word. We're on the verge of a government shutdown imposed on the American people by House Republicans. And unfortunately, here we are today with folks focused on trying to push through more than $70 billion in unfunded tax breaks that will overwhelmingly benefit the wealthy. If enacted, these measures, both of the bills we're considering today, would increase our federal deficit and reduce the lifespan of the Medicare and Social Security trust funds. It comes at the same time House Republicans are proposing giant cuts for schools, clean drinking water, cancer research, and even law enforcement. These tax breaks do the least for workers and middle-class families in my district who need the help the most. While I support the Bipartisan Primary Care Enhancement Act, which would allow people with health savings accounts to have greater access to primary care, there are many proposals before us which I do not support. Therefore, I plan to oppose both packages. I yield back.
I now recognize the gentleman from North Carolina, Dr. Murphy, for 5 minutes. And he is not here. I now recognize the gentle lady from California, Ms. Chu, for 5 minutes.
I move to strike the last word. Mr. Chair, I am deeply concerned that today we will mark up two bills totaling $71 billion in cost that once again fails to expand access to health care and bring down costs for consumers. And the timing could not be more contradictory, as Republicans are inching us closer and closer to a government shutdown and proposing dangerous cuts to NIH, the CDC, the 988 Suicide Crisis Lifeline, and other vital health care programs. They are simultaneously pushing $70 billion in unfunded spending to give wealthy people more opportunities to shield their income from tax. We should be spending the $71 billion to enact important changes that will improve the health of average Americans, such as closing the Medicaid coverage gap or permanently extending premium tax credits for ACA marketplace coverage. Most Americans are just one medical emergency away from a financial crisis, and about 36% of Americans can't afford a $400 emergency medical expense. How can we then expect them to fund an HSA while paying for necessary routine care in high-deductible health plans? HSAs are not helpful for people who can't afford to save, let alone for tens of millions of Americans struggling with medical debt. And there is a significant population that isn't being served by these high-deductible health plans with health savings accounts: pregnant women. That is why when this committee marked up a series of HSA-related bills in 2018, I offered an amendment to create a special enrollment period for pregnancy to allow those with high-deductible health plans and health savings accounts the option of enrolling in more comprehensive health coverage. High-deductible health plans are often sold as good options for young, healthy individuals who are not expecting significant health care costs over the course of a year. However, we know that in the United States, 50% of pregnancies are unplanned. That means that for some people, their medical expenses could go up significantly and unexpectedly. While giving birth or adopting a child currently triggers a special enrollment period, becoming pregnant does not. And yet, we know that there are significant medical costs during pregnancy that impacts the health of the baby and the mother. Maternity care services without complications range from $10,000 to $20,000 per pregnancy. Additionally, most pregnancies last 9 months, which means that they span 2 separate plan years. This means most pregnant mothers in high deductible health plans have to hit their deductibles twice, within the course of a single pregnancy. Unfortunately, this can lead to some mothers foregoing critical prenatal care because they can hardly be able to afford it. We risk leaving a gaping hole in coverage if we do not address the specific needs and healthcare costs of pregnant women, plus the millions of other Americans struggling to afford basic health care, plus the tens of millions of Americans who've been kicked off of their health coverage during Medicaid unwinding. But instead, we are spending $71 billion in tax breaks for health plans that leave vulnerable consumers on the hook for more costs. We must do better, which is why I will be voting no on these bills today. I yield back.
Thank you. I now recognize the gentleman from North Carolina, Dr. Murphy, for 5 minutes.
Thank you to the ranking member. I think this has been an excellent discussion. I mean, I understand there are some cons to this. I'm going to speak it from a little bit two different lights. One, I want to thank Mr. Blumenauer. He's absolutely right about primary care that's paid directly. It's an absolute way to do it. Unfortunate, we just don't have enough doctors. That's one of the main problems that we have in this country, and as much as we want to say there's access issues, the main issue is we are way behind in getting doctors, but that's a different thing. As an employer, and this has been spoken to before, about how this is an attractive keeping tool for keeping individuals employed, is that you offer health care. You pay for their HSAs. Now, I think some of the statistics popped around are a little bit askew. Remember, approximately 20% of the individuals in this country are on Medicaid. So if you look at those who are under $60,000, a significant number of those individuals are already getting health care through Medicaid. So these HSAs are not taking anything away from them. My friend Ms. Chu just brought up about unplanned pregnancies. 70% of unplanned pregnancies are covered by Medicaid. So putting facts to facts, let's just bring some real stuff here. We talk about debt, HSA. Wouldn't it, you look now, we have the greatest credit card debt we've had in a long time. It's topped $1 trillion. So people are going to pay their health care bills with a credit card. Yeah, they're paying the bill, but look at the charges and the interest rates and everything else that we have. We have a mechanism now where it is matched by an employer for a person to save money for expenses as they move forward. You know, yes, it does take some of the tax base off, 100%. Absolute, understand that argument. But if you look at time with investing, we look at the Medicare issues that we are facing. If you start something earlier in life and you begin early habits, you get your hypertension taken care of, you get diabetes if you're diagnosed, under control, you get your obesity under control. When you are pre-Medicare and you're able to get these things because you have an HSA and you're actually able to afford going to the doctor, the savings on the other side of the stream after age 65 is absolutely immense. Yes, it is a cost up front, but our job is to not be static. Our job is to look forward and see what investments now can we give to we offer individuals so that they can put investing their money in so that, number one, most importantly, they have a healthy future, and two, actually brings us savings in the long run, keep Medicare, Social Security, et cetera, those mandatory programs much more solvent. Yeah, I understand their arguments, pros and cons, but this is actually an investment. It saves in ED visits, it saves in hospitalizations, it saves in so many different things moving forward. I think this is an absolute plan. Is it perfect? No. Could we cover everybody? No. Is it expensive? Yeah, these high deductible plans are expensive, but just think without them, how many people could afford the insurance? They can't. So again, it's part of a package that investing here now gives us a good chance of solvency and better health in the future. Thank you. With that, I'll yield back.
Thank you. I now recognize the gentle lady from Wisconsin, Ms. Moore.
Thank you. Thank you so much, Mr. Chairman. And I do think this has been a very vigorous, helpful discussion. And as I look through all of the materials that have been provided to us today and recalling the discussion. I realize that this is, we're mostly talking about a tax shelter for the wealthiest people. I don't even know that there's any evidence, and no one has pointed out the extent to which people actually use this for health care, so much as they use it because of its limit, because it has no cap on the income that you that you have. It certainly differs from other insurance plans and 401ks in terms of contribution levels, and you can roll these things over and over again. You can invest them in the stock market. This is a brilliant strategy for no tax income, untaxable income. So I think that if you're wealthy, you ought to be healthy. To borrow that term, I thought that that was very, very clever. But I will say that the monies that the Treasury loses on this could so much better be used for those 80 million people on the Affordable Care Act who need more premium support. And I think that it's very, very difficult to walk away from this discussion when I was up late last night voting on crazy stuff that don't contribute at all to keeping the government open. I spent all night voting on these amendments and gonna do it again tonight, have a late night, and then have to drag myself in here all day long so we could provide yet another benefit to the wealthiest people in our society. I tire so of hearing about fiscal responsibility when we've got a $71 billion deficit-funded benefit for the wealthiest people. And just to clarify, these distributional tables that were provided to us by the Joint Committee on Taxation, as I see it, the economic benefit of these $71 billion, goes to the wealthiest people. That is really a de minimis amount of benefit that goes to people who make under $100,000 a year. And certainly most of the benefit goes to people who make $200,000 a year or more. I think that, before we extend yet another tax break to the wealthiest people in our society, we ought to figure out how to provide fruits and vegetables to our children instead of cutting $800 million out of WIC. I think before we provide yet another tax shelter to wealthy people, we ought to try to figure out, how to use the federal government resources to help the least, the lost, and the left behind. And so with that, I would yield back. And of course, you realize that I'm not going to support this bill. I realize that there are many well-intentioned people on both sides of the aisle, but the timing for this initiative is off when we consider so many people who are suffering with no health care at all in our country. We just need to keep the main thing, and I yield back.
Thank you. I now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes. I now recognize the gentleman from Pennsylvania, Mr. Evans, for 5 minutes.
No, Mr. Chairman.
I now recognize the gentleman from Pennsylvania, Mr. Smucker, for 5 minutes.
Thank you, Mr. Chairman. I'd like to address just a few of the issues that were brought up in regards to this bill, and starting with some of the issues Mr. Larson brought up, and I appreciate his kind comments. And he talked about Social Security. And I agree. I think we all agree that we need to do what we can. We must ensure that those who have paid into the system of Social Security will be able to rely on the promise that has been made in regards to that. And I'd like to also remind Mr. Larson and others that when President Biden introduced his 10-year budget, it was the first time that a president introduced a budget during which that 10-year period Social Security was projected to go bankrupt. So that people in the 9th year of his budget time period would receive less benefits if nothing were done, yet the president had no plan included in his budget that would fix Social Security. I'd also...
Gentlemen, yield?
Sure, just very briefly.
All right.
Will you yield?
Yes, I will yield.
The president does have a plan. It's incorporated in our bill, Social Security 2100.
And I'll reclaim my time. Thank you. It was not included in his budget. It was not referenced in his budget in any way. But the point I want to make is it should be fixed. And I advocate for some sort of commission that would do exactly that. We could fix that. It's one that should be done. I'll also point out, you said Social Security benefits have not increased. There's an inflation provision, so over time it has increased. And then finally, the HSAs, not just theoretically, but can benefit someone on Social Security if prior to their retirement they've been putting money into an HSA. That money would be available to them while they're drawing Social Security checks to help to pay medical costs. And so HSAs can be beneficial to someone on Social Security. Having said all that, it's a bit of a red herring because it's a very different issue, and the scale of fixing Social Security compared to what we're talking about here is it's not even comparable in scale in any way whatsoever. In fact, I'd like to, it's the biggest charge from Democrats that I've heard on this bill. And they're just, appalled about $71 billion in spending over a 10-year period. I get it, we don't want to add to the deficit, but I'll just remind Democrats that they voted just recently to expand Obamacare subsidies, enhanced subsidies, which cost $250 billion over 10 years, as opposed to $71 billion. And in fact, all of the ACA subsidies cost almost $1 trillion, $950 billion over 10 years. And the entire cost of all federal medical benefits in a one-year period is $2 trillion. $2 trillion. And you're talking about as if the world is falling if we spend $9 billion per year on this program. I mean, it's the scale of what you're talking about just simply, it doesn't comport. Having said that, every expenditure relative to health care ought to have, the benefits ought to outweigh the costs. And other members have talked about different provisions of this bill, but I want to talk specifically again about direct physician care. And I want to share why this is important to me, and I appreciate Mr. Blumenauer's support for this as well. It's because I've heard from my constituents. And they've told me how important it is for them to be able to have access to a doctor on a monthly basis when they can, often it includes a teleprovision. They can call the doctor through phone, video. That doctor is available to them almost on call like the old-time family doctors. It makes a difference in the care that they're receiving. I've also heard from business owners who have actually brought physicians on site. And so individuals tell me that instead of taking the time out, having to schedule an appointment, taking the time to drive to a physician, they may have a physician available right at their work site, and that's included in this bill as well. These are important provisions that are helping individuals and their families access care in a much better way. I've also heard from doctors who tell me that all of the insurance provisions, all of the regulations, the paperwork, have taken the joy out of caring for patients. And this is an entirely different system when they aren't obligated to see a new patient every 20 minutes. Instead, they can take the time that's necessary with each patient as the need arises. And the results will far outweigh the costs, because I submitted documents earlier here. Direct care patients spend 30% less on health care on some of the studies that are out there, 30% less. Think about that. They spend less time in the emergency room because they're getting treatment early. So this is at a fraction of the cost of what we're spending on health care. The benefits.
Mr. Smucker, your time is over by a minute and a half.
Sorry, Mr. Chairman, I wasn't paying attention to the time.
Okay. All right. Thank you. Mr. Snyder is recognized to strike the last word.
Thank you, Mr. Chairman, and I promise to be in my time.
Mr. Chairman, I reserve a point of order.
Not
Oh,
here.
last word? Okay, good.
We're not going to point of order. You're striking the last word.
I haven't even said anything yet. Thank you. I'm proud to be a co-lead of the Primary Care Enhancement Act, along with my colleagues, Representative Blumenauer, Smucker, and Tenney. This bipartisan effort, which has been included in today's HSA Improvement Act, will expand access to the direct primary care by allowing individuals with HSAs to use those funds to access this payment model. Direct primary care allows patients to adopt a regularly scheduled payment plan for all their primary care services, in contrast to the traditional fee-for-service model. Direct primary care is a cost savings for both the patients and the employers offering the health care plan. I've always believed that an ounce of prevention is worth a pound of cure, and the investments we make in preventative care save us money in the long run, as well as improving the quality of life for patients. We know that when patients proactively see their primary care providers, they experience better health outcomes at lower cost. Innovative payment models like direct primary care are a proven, effective way to incentivize health habits and get consistent treatment. I'm glad that this effort has won bipartisan support, because improving health outcomes shouldn't be a Democratic or Republican issue. It's a human issue. The Primary Care Enhancement Act tackles health care in the most fundamental way by encouraging people to see their doctor before minor health ailments become major problems. There is no reason why, if an individual can use HSA contributions to pay for primary care deductibles and co-payments in traditional health insurance payment models, they shouldn't be able to use HSA money to pay for the exact same primary care using a direct primary care payment model. Once again, I thank my colleagues who have worked on this bill. I invite you to join me in voting for this effort and support primary care and healthier patients. And with that, Mr. Chairman, I yield back and allow Mr. Buchanan to do his point of order.
Mr. Kustoff is recognized to strike the last word.
Mr. Chairman, move to strike the last word, and I yield my time to Mr. Smucker.
Mr. Smucker.
Thank you. I'd like to thank Mr. Kustoff for yielding. Wanted to address one additional point that has been brought up repeatedly, and that is that HSAs are only for the wealthy. They're only for upper-class millionaires looking for a tax break. They're a tax break for the wealthy, and that charge is just completely false. The average household income of Americans with HSAs is $78,000. This is working-class Americans that we're talking about. 78% of all account holders earn less than $100,000, and 62%, the large majority of individuals with HSAs spend the money they save through their HSAs each year on medical expenses that they incur. And then one additional final point. I talked about all of the Obamacare subsidies and the scale of what we're talking about, dollars going out and flowing to people. And I'm not debating whether they're effective or not. We want to ensure people have access to the health care they need. But that's taxpayer dollars being spent. HSAs are simply allowing taxpayers to use their dollars more efficiently. They are a credit. Now, you could argue it's the same thing, but there's a slight difference in how they're administered. This is allowing more people to keep money in their pockets to help them make the decisions that are right for them in how they spend their health care dollars. And with that, I'd like to thank Mr. Kusoff for yielding, and I yield back the balance of my time.
Thank you. Mr. Chairman, I yield back my time.
Thank you. Are there additional members who wish to strike the last word? Seeing none, we will move to amendments. Are there any amendments to the amendment in the nature of a substitute?
I have an amendment at the desk.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask that the gentleman will suspend while the clerk distributes.
Thank you. You did it there.
I just read it. It's in order. Just delete. Proceed, Mr. Doggett.
Thank you very much. This is the no HSAs for yachts amendment, but I do want, in explaining it, to respond directly to what Mr. Smucker just said. I have no doubt that he and other supporters of this legislation are well-intended, and that some individuals do make use of their HSAs for their health. But my concern is the impact, and some of the statistics that have been cited are misleading. It is correct, as he just said, as the chairman said at the beginning, that 78% of HSA account holders have an income below $100,000. But it is also correct that only 5% of those people report having ever contributed a single penny to their HSA account. They may be an account holder, but they do not make use of the HSAs. And in fact, there is other data that shows that about 1% of those earning less than $50,000 have received any benefit from HSA. This is not about health for most people. It is about tax shelters. And this amendment is designed to prevent those tax shelters from exploding in this bill. After age 65, there is no longer any penalty for using an HSA for a non-health purpose. And in fact, there's a whole industry that is out there advertising. One blog I saw says, after age 65, you can use your HSA withdrawal for non-medical expenses without paying the 20% tax penalty. New flat screen TV, beach house deposit, check it out. Another titled, How to Buy a Boat with Your Health Savings Account. Another, after turning 65, you can use your HSA funds for a boat or an exotic vacation. And I've just tried to summarize those here. Under the legislation that is being offered today, at 65, it can be a substantial amount of money. Under their bill, someone who's 30 years old and contributes the maximum amount to their HSA, even if they didn't adjust for inflation and they increase it, even if you didn't compound the interest or the earnings, you'd have over $500,000 by the time you reach age 65. So it's not surprising that you could take a really fancy vacation, that you could buy a new car in Pennsylvania or Virginia or anywhere else, that you could get a new boat, a big one, that you could have a home vacation, a home renovation, a new flat screen TV for sure. That would, 1 year, you could get a stack of them. Or that you could have a beach house deposit, or maybe if you really invested well with that money, you get the whole beach house, not just the deposit. And so if the goal is health,
use the money for health. If it's not for health and it's really a tax shelter, which is our concern, about Republicans who come here today, have told us how desperate we are to control the nation's debt, but don't even wink at the notion that they're going to spend perhaps $100 billion that will be added to the debt. They could offset it, they could do any number of things, but $100 billion, and much of that money is going to go right here. It will have nothing to do with health. The people that need health the most are those that are getting little or no benefit, 1% of the benefit if you earn $50,000 or less. I think that it is wrong to cut thousands of teachers, as is being proposed in the Capitol, to reduce medical research, to leave thousands of people without food assistance, and instead increase the debt for a beach house, a new car, a yacht, a fancy vacation. That's just not just. And my amendment won't correct all the problems, but it will at least assure that when you get to age 65, you can still keep using it for health, but you can't use it for a non-health purpose. And I yield back and move the adoption of the amendment.
I'll speak on the amendment. I would adamantly oppose the gentleman's amendment. It is good that we have those safeguards in place right now, that if an individual decided at 65 to withdraw enough to purchase a new car or all the other items that you put on your board, they would have to pay tax on that, plus face a 20% penalty. So they clearly, the safeguards are current law in regards to preventing what you're there. So I would urge the body to vote no. Further discussion on the amendment. Mr. Kelly is recognized.
Okay. I just want to weigh in on this because I'm getting to the point right now. How dare these Americans use their own money the way they'd like to use their money? You know, you've talked about some of the things that we talk about. This is bizarre. This is bizarre, and we keep talking about the real cost of this. The real cost, when we say it's a cost at this level, what it means is hardworking American taxpayers got to keep their money.
Yeah,
They got to keep their money. Now, how foolish are they to go down that type of a path? What is wrong with these people? Don't they understand the arithmetic in this? My God, why would you ever think that you shouldn't be supporting this business? I hope these people come by. Oh, by the way, as far as new cars are concerned, I'm not joking about that. I'm going to assume when you talk these things about people using their own money to do what they want with it, and somehow it was a tax shelter. So when we talk about this, according to Fidelity, an average retired couple, age 65, in 2023 may need approximately $315,000 saved to cover health care expenses in retirement. Again, how dare these people plan for their own future? How dare they take advantage of this terrible tax scam? I'm so sick and tired of hearing what the cost of this is. The cost, as I'm telling you, the cost is the government didn't get the money, the taxpayer got to keep their own money, and we call that a cost. That's a cost. We've been here too long. We've been drinking this grape Kool-Aid too long. This is a scary damn thing for me. When the smartest people in the world, now I shouldn't say that, when people get elected to come here because they get more votes than somebody else and then decide on policy, I just hate, I'm astounded by the amount of knowledge that flows into their head once they're elected to develop policies on which they have actually no background, but they always go to this, the cost. I am really in favor of people who get up and go to work every day and pay their way through life, and they get to keep some of their money that they earned, and it didn't go to the government, and all of a sudden they're taking advantage of it. That's a cost to our government. I would say the benefit to our government is these people have worked hard their whole life. They've been really, they've been makers, not takers. And this is the problem that we have. This is the problem that we have. How dare we come up with a policy that actually allows people to keep their own money? That is just bizarre. Chairman, this has been an interesting conversation, but it always seems to come down to the same thing. I really wish we could talk about the people we represent. I don't care how they vote. I don't care if they vote Republican or Democrat or Independent, and some people now have got to the point they figure there's no use even voting anymore. They're giving up on the whole system, which is the saddest part of all. But at some point, could we stop being political and all these things and start talking about policy? Policy that actually helps hardworking American taxpayers, and not call them tax cheats for trying to keep their own money in some kind of a scam that's were developed to allow these people to actually be that audacious with their own future. I'm amazed sometimes. I don't, by the way, have any problem with anybody on the other side of the aisle. I really don't. So we disagree on a lot of things, and that's okay. You're allowed to do that. I'm just amazed sometimes that the people that are always the villains in this, are portrayed as the villains, are the people who actually use their own money the way they would like to use it, and they're into programs that somehow it costs the government for these people to look to their future and how to prepare for it. So, Chairman, I want to thank you for bringing this forward today. Mr. Smucker, it was really it was good to sit and listen to you. But again, I would just tell our friends on the other side, can we please take a look at who it is we're talking about when we say it was a cost to the government? Chairman, I yield back, and I appreciate the opportunity.
Further discussion on the amendment? Mr. Kildee?
Thank you, Mr. Chairman. In a moment, I'd like to yield to Mr. Doggett to specifically respond to some of the assertions that have been made, but I can't miss the opportunity to at least respond to my friend, Mr. Kelly, who is my friend. But when we talk about the cost, I understand your point, I really do. And I think there is some area where we might find agreement on this. But when we talk about the cost of this, the cost to the taxpayer is one where somebody has to make up for the unpaid taxes that individuals fail to pay because they perhaps disproportionately take advantage of the tax code to avoid paying their fair share, and somebody else has to then chip in more. That's where the cost is. It's not to the Treasury necessarily. It's to other taxpayers who are not in a position to take such great advantage of these special benefits. With that, I'll yield to Mr. Doggett.
Well, thank you very much. Let's talk about makers and takers. Let's talk about the interest in having people be healthy and being fair and being able to keep their own money. Talk about it in terms of two workers. Let's say one of them is called Larson, earns $50,000 a year. He has an HSA, but if he's like most people with an HSA, only 1% of them get any benefit at all from the HSA. He pays his taxes on the $50,000. But we got another worker who is leaving pretty much on easy street. Let's call him Pasquale. He earns $500,000 a year. And with his $500,000 a year, every year he tells people, I don't want to pay taxes on $15,000 of it. I'm going to put that in an HSA. And he doesn't have to pay any taxes on it. And that $15,000 year after year earns interest, earns dividends. He doesn't have to pay taxes on any of that. And when he gets to be 65, he's got millions if he's used this effectively and invested it effectively. And he will, and the chairman, if I understood him, is in error on this. When he gets to be 65, he can use that for the fancy vacation, for the new car, for the boat, for the house renovation, for the more than the deposit, for the whole beach house. He can use it on that. He will have to pay no penalty whatsoever. It is true he will have to pay the tax rate, but it's likely that even somebody who's done as well as Pasquale is going to be paying at a lower rate than in his highest earning years. And so to say that it's right to treat a hardworking maker, not a taker, who has earned $50,000 or less per year, that every dollar that he earns has to be taxed, but someone who's living on Easy Street, they only they can void $15,000 year after year, and when it's all over under this legislation, they can use it for purposes that have absolutely nothing to do with health. All this amendment does, it doesn't end HSAs, though I think that would be desirable. It doesn't change any of the other provisions. It simply says when you get to be 65, keep using it for health. You can use it for health just like you could when you were under 65. You can't use it for the beach house, the yacht, the home renovation, the fancy vacation. And I urge adoption of the amendment.
Further discussion on the amendment? Seeing none, all those in favor signify by saying aye.
Aye.
All opposed, say no.
No. On that, I would ask for a recorded vote.
The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Dr. Murphy, no. Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Fitzpatrick, no. Mr. Stubbe? Mr. Stubbe, no. Miss Tinney? Miss Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele? Mrs. Steele, no. Miss Van Dyne? Miss Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Miss Maliotakis? Miss Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Ms. Moore, yes. Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Mr. Arrington? Mr. Hearn? Chairman Smith?
No.
Chairman Smith, no.
The clerk will report the vote.
The ayes are 18, the noes are 23.
There being 18 ayes and 23 noes, the amendment is not agreed to. Are there additional amendments? Mr. Larson.
Mr. Chairman, I have an amendment at the desk.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentleman to suspend while the clerk distributes. Proceed, Mr. Larson.
Thank you, Mr. Chairman. This is straightforward, and let me say first and foremost how much I've appreciated the discussion this afternoon. And I think the issue of primary health raised by Mr. Blumenauer, Mr. Schmucker, and others has been informed and insightful. My concern, as I stated from the start, and will always say on this committee, as is Mr. Bartold underlined, is that this is a direct hit on the Medicare and Social Security Trust Fund. So the amendment's pretty straightforward, Mr. Chairman, and it'll take me a second to read it, that the provisions of this act, including amendments made by this act, shall not take effect if prior to December 31st, 2025, the Secretary of the Treasury, after consultation with the Social Security Administration, determines that such provisions will reduce aggregate receipts to either the Old Age and Survivors Insurance Trust Fund or the Disability Insurance Trust Fund. Look, we're in a crisis. It's staring us. 10,000 baby boomers a day become eligible for Social Security. There hasn't been congressional action to address this in more than 52 years. This isn't benign neglect, and yes, both parties bear responsibility for this, but it's this committee's responsibility, the Committee of Cognizance, number one, to protect Social Security, and that's what this amendment seeks to do, but number two, also expand it. I say to my colleagues on the other side, because I know of your interest in protecting the individuals in your district, there is no better economic development plan than Social Security, because those very people that need it the most, those on a fixed income who are hurt the most by inflation, haven't seen any enhancement in 52 years. 23 million Americans would get a tax cut under our provision. We have a plan, and that's what's wrong sometimes in Congress. You have a plan, you put it out there in writing, there ought to be a vote on it. And people ought to know where you stand. And in this case, it's about the 5 million fellow Americans who get below poverty level checks, most of them women, because they were care providers. Isn't it long overdue that we lift them out of poverty? It's great that we can provide tax cuts for other people and the wealthy. God bless them. But how about we take care of those who have also, as Mr. Kelly notes, paid in with their own money? This is no entitlement. This is money they have paid into the program, and they deserve it back by way of a credit. We don't have to go back to 1929 to look at the great crash. You only have to go back to 2008, 2009, and where people watched their 401k become a 101k, where people saw during that same period that Social Security never missed a payment because it's the full faith and credit of the United States government. That's us. And we're responsible. And here we are on the midst of a government shutdown, which again, I hear from the other side that's not going to happen, so we're heartened by that. And where we're facing this crisis, and we need to act, and we need to act now and vote. That's what this amendment is about protecting the trust fund and making sure, as Mr. Bartold has laid out, that that hit doesn't come at the expense of otherwise well-intended notion of a health savings account. And with that, I yield back.
Mr. Schweikert is recognized.
Thank you, Mr. Chairman. And look, I love your enthusiasm on wanting to save Social Security. I wish you could actually have gotten the president to actually save Social Security during the State of the Union instead of light those of us on fire who'd been working on it. But let's do a little math here. And I know this is sort of a math-free zone. So the hit here, let's just use 2033, so we all are hearing the thing. So 9 years, 2033 is what, 9 years. Who here can tell me what the first year shortfall in Social Security is? Come on. We're all supposed to care about this. Where's your expertise? It's $616 billion is the estimate for the first year of Social Security. We will double senior poverty. It's absolutely immoral.
Right.
To completely eliminate the cap, the solution we keep getting produces $168 billion in that first year. It only covers 20% of the shortfall. Do you know what this piece of legislation here? Now, it does have a hit. It's $2 billion. I have $168 billion in that year is all the tax of just removing the cap and no benefit being paid. The first year shortfall is $616 billion. I appreciate this is 2. But have we lost our minds in understanding scale? Turns out 2 compared to 616.
Will the gentleman yield?
This is ultimately rounding.
But where is it coming from?
What coming from?
Where is that money? The hit
No,
that's
excuse me,
coming to Social
Mr. Chair,
Security?
Mr. Larson, go ahead. Where's what coming from?
The hit that's coming to Social Security.
The hit that's
You're
coming
already talking about Social Security being depleted.
Oh, yeah, but
ninth
look, it's
year.
called, okay, I'll take that. Mr. Larson, you know I care passionately. I'm one of the idiots who actually has the entire CBO and the Medicare Social Security actuary report highlighted on top of my desk right now, every line, and then vetted. And I'm heartbroken here because we have people talk about, I care about Social Security, and they have no damn idea how short the money is. And then they live in this fantasy world, just raise the cap, we're fine. It covers 20% of the shortfall. We've got to stop lying to each other. The scale of recapitalization of this program is going to be brutal. We're going to have to hold hands and do it together, but we need to start understanding the scale.
What does
of the
that
actual
mean,
underlying
hold hands? Well, you
Please,
have,
we
okay,
need a
one
study,
more
or
time.
we're
We're going to have a study, or we're going to hold
Mr. Larson,
hands.
let's reclaim my time. I still have a whole 2 minutes.
I'm sorry, I apologize.
$616 billion is 1 year. 2033, the first year the Social Security Trust Fund is emptied. $616 billion. That's not that far off from our entire non-defense discretionary spend this year. There seems to be this misunderstanding, the scales we're talking about. The solution that keeps
What misunderstanding
and
is
Mr. Larson, let me finish. The scale the solution I keep getting from my brothers and sisters on the left, just raise the cap, that will cover it. It barely does 20% of the shortfall. So we omit our passion to save this. We're living in this world of absolute fraudulent math. And look, there were those of us when I was ranker on this, I spent a year of my life trying to work with people in the Senate. We actually had some Democrat senators coming to the secret meetings. And then the president got up in the State of the Union and said, you're not allowed to talk about this. And do you remember those of us in the audience going, oh God, he knifed us?
Yep.
9 years, $616 billion shortfall. The best solution I get from my Democrat brothers and sisters is raise the cap. And if you do the cap over just 400,000, which was one of the other proposals I heard, that only produces 86 billion. We need to buy calculators.
I want to yield to the.
Well, you don't have anything to yield, but
I
I would
still
be
have-
happy to give.
still have.
Mr. Chair, I would, for the ranking, for my good friend, I'll give you my last.
Thank you, Mr.
Share with me,
Spiker.
why am I?
Would fraudulent math include the perpetration of the argument in this town that tax cuts pay for themselves?
Okay, once again, Mr. Chairman, see what you just did? I'm trying to have an honest conversation about saving Social Security, and we immediately went back to our talking points. And look, I'll go to, should we get engaged in the fraudulent discussion of just tax the rich? It's fine. We need to stop what you just did. That's almost immoral when we're talking about 20% doubling senior poverty in 9 years.
Where's your plan? We got a plan.
The time is-
Where's yours?
And your math doesn't come close to working.
Well, put
The
yours out there
time
and vote on
Close
it.
to working.
The time has expired. Mr. Smith is recognized.
Thank you, Mr. Chairman. I yield my time to Mr. Schweikert.
Mr. Chairman.
I don't mean to be emotionalizing this, if that's a word. This is a big deal. But we play because it's so powerful politically. Most of us are terrified to go near it. And then many of the plans that I get, we worked out the math, and they don't tell the truth. They don't get anywhere close to the truth. And now we're seeing some of the new data sets on the number of baby boomers that are expected to be homeless over the next 20 years because of rents and other things. Mr. Larson is absolutely correct. We have a moral crisis coming, but the only way we fix it is accuracy in math. And that's just where I was going with this. Thank you. I yield back.
Mr. Thompson is recognized.
Thank you, Mr. Chairman. I yield to Mr. Larson.
I say to my friend who is equally passionate about math that this is about people. This is about human beings. This is about people that we take an oath of office and are sworn to serve. This is about your brothers, your sisters, mothers, fathers, uncles, the people you go to church with. This is the nation's #1 anti-poverty program for the elderly, the #1 anti-poverty program for children. It needs to be funded. I don't care what math you put over it, but you need, if you're going to fund it, to put forward a plan. Now, if you disagree with the plan, fine, put yours out there. I'm anxious to see how you're going to pay for it. What we've seen is that you're going to make cuts across the board. That's how you're going to pay for Social Security. But then you don't talk about the numbers that really matter, the people that are actually impacted by it, who live day to day, on average, here's some numbers for you. I have numbers too. The average amount that a person gets on Social Security for a male is $18,000.
Mr.
For a
Chairman,
female,
will
it's
Mr. Larson yield for a moment
$14,000.
on?
And 5 million fellow Americans.
I was very
get
courteous
below-
to you in yielding before. I yield to you
Get
multiple
below- I
times.
will yield.
The
to you.
gentleman
Let me
from
finish my
Connecticut,
point.
it's his time. The gentleman from Connecticut has the floor.
5 million fellow Americans get below $12,000 from the federal government after having paid into a system. Those are real numbers. Those are real people that are impacted by those numbers. And for people that haven't paid their fair share, how many Americans do you think know that people stopped paying into Social Security after $167,000?
162,000.
How many people do you think
762.
realize that people over 400,000, that wealthy people stopped paying on January 2nd, for God's sake?
Okay.
These are the facts that matter as well in terms of the fairness and the people that are out there and deserve it. And either we take the responsibility. This is nothing the president can do by executive order. This is nothing that the Supreme Court is going to adjudicate. It's Congress's responsibility, and it's neglected it. An ineffective COLA that doesn't work. Sure.
Thank you, Mr. Larson. I want to make sure we're not talking around each other. In 2033, the average American couple takes what? What's the scale of the cut? What's the math? You told me you knew the math. What's the cut on the first year?
The math of what?
The average American couple will take a $17,400 cut come 2033. We will double U.S. poverty of seniors at that time.
Right.
And we actually had that testimony here.
Right.
So, look, I appreciate the passion of, and we need to change. I agree with you. There's some distributional effects within the current way the formula works, absolutely. But saying, as you just spoke to, okay, $400,000 up, have them pay the 12.4%. It produces $86 billion on that first year. I have a 616 short. What would you like to do with the other 500?
What would you like to do?
We've actually worked for a
Really?
year coming
Have
up.
you guys put out a plan for it?
You basically.
Well, he's using my time if I.
Yeah, no, it is your time, and he's being kind enough to give me a moment of it. And I actually enjoy the conversation.
I do too.
Until it becomes
Where's the plan?
But until comes the moment where we're allowed to talk about it without waking up the next day and having the DCCC running ads attacking, and vice versa, or the working group we had with the Senate and a couple Democrat senators, and then we presented to the White House twice, and the White House during the State of the Union knifed us. It's not a demonstration of good faith that you actually, not you care about it passionately, but that you actually are here to save the program.
It's this committee's responsibility. It's this committee's responsibility.
Actually, it's all.
Not the president's, it's not the Senate's, it's this committee's. Where's the plan?
Okay,
we'll put out our plan.
Okay, ignore the concept.
All right,
of
how about we
weaponized-
put out a plan and have a vote on it? You can add all the numbers that you have and everything else, and everybody will get a chance to talk about it. But for God's sake, let the American people know that we'll vote on it. That we'll actually take a vote on Social Security.
And Mr. Chairman, I appreciate your
let's
patience.
time-
It's a novel
time is-
thing.
The theater becomes more.
Okay,
than the
time is
facts.
expired. Are there further discussion on the amendment? Seeing none, the question is on agreeing to the amendment offered by Mr. Larson. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Mr. Arrington? Mr. Arrington, no. Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Dr. Murphy, no. Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Stubbe? Mr. Stubbe, no. Ms. Tinney? Ms. Tinney, no. Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Pascrell, yes. Mr. Davis? Mr. Davis, yes. Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Dr. Winstrup? Dr. Winstrup, no. Mr. Hearn?
Mr. Hearn, how are you recorded?
Mr. Hearn is not recorded. Mr. Hearn, no. Mr. Fitzpatrick? Ms. Moore, Chairman Smith.
No.
Chairman Smith, no.
Clerk will report the vote.
The ayes are 17, the noes are 24.
There being 17 ayes and 24 noes, the amendment is not agreed to. Are there additional amendments? Yes. Mr. Pascrell.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentleman to suspend while the clerk distributes. Yeah, just while we're looking at this amendment, I would just inform everyone that we're going to work up until we need to head to the floor, and then we have 33 votes on the floor. Then we'll return back after those votes and be here until we finish. Mr. Pascrell.
Yeah. Mr. Chairman, how are you? I saved up my time, you notice, Mr. Chairman. I got a lot to say about this. And by the way, Mr. Larson, we are all in this room still waiting for the peace plan to end the Vietnam War. Oh, it's in the mail. No, that guy's gone. That was the postmaster. Second, we're still waiting for the plan to respond to the lack of health insurance with a lot of Americans. We're still waiting for that plan, too. And the third thing, right now, how convenient, we're still waiting for a plan on immigration reform. Remember that? We have a plan, so don't get your hopes up, Harry. Look, I got a little change of venue, Mr. Chairman. I hope you don't mind. But I promise you it's on the subject. Look, the Republicans stole the state and local tax deduction lifeline from the middle class. Middle-class families in 2017. I remember every day. I even memorized part of that. It only cost $2 trillion. $2 trillion. You're going to sit over there and cut the heck out of this budget and look up with the true face of the people in your district. Don't worry about my district. I'll take care of that. You take care of your district. This is what we're going to cut. I want you to stand in front of them, and I want you to tell them, you're again seeking to advance an expensive tax bill. Where's your charts on this? I believe any tax bill must properly address SALT. The bottom line here is, how do we get the revenue? Then what do we spend the revenue on? And do we spend it on legitimately? The amendment I'm offering mirrors a Republican bill. Get that. Introduced by Representatives Nick LaLatta from New York, Anthony D'Esposito, Mike Lawler of New York, and Mike Garcia of California. Every single Republican on this committee, just to straighten you all out here, voted against its passage during the markup on Tax Scam 2.0 in June. in June of this year. I hope they have seen the light. If the other side continues to stand against tax fairness for middle-class teachers and cops and firefighters, they should explain why to their constituents and each of their colleagues. And I just told a group of union organizers, I just said that you will not catch up and shut down the gap that exists in income in this country until, which is, we've had increases of 4.5%, 5%, not bad in our minds. You'll never in any way change that gap. The numbers are the numbers. So, in 2020, New Jerseyans reported an average of over $26,000 in SALT, $26,000. They were paying taxes on an additional, can I have order in here, Mr. Chairman? Thank you so much. You've always been fair, and so I can continue. Thank you. $16,000 of income under the punishing cap that we put together. That is thousands of dollars more at tax time. A lot of towns in New Jersey, my town I lived in all my life, a lot of towns in Staten Island, which I just visited recently. It's either true or it's not true. Look at the numbers. Addressing the SALT cap should be bipartisan. We have colleagues on the other side of the aisle whose constituents have been brutalized, Mr. Chairman, brutalized by the SALT cap. In 2020, the average Californian reported over $31,000 in SALT.
Mr. Pascrell, your time has expired. Are you wanting to withdraw your amendment?
Do I want to withdraw my amendment?
Yeah.
No.
It's not germane, and you can either decide to withdraw it or...
I'm going to appeal that, your decision.
Okay, Mr.
I didn't
Buchanan.
finish it, and you still called it out of order, huh?
You're 30 seconds out. Mr. Buchanan.
Mr. Chairman, I make a point of order to the amendment because it's not germane to the underlying bill. Under Clause 7 of Rule 16, amendment on the subject differ from the under consideration or amendments outside of this committee's jurisdiction are not germane and therefore not in order.
Mr. Chairman?
The chair is prepared to rule. The gentleman from Florida makes the point of order that the amendment proposed is not germane. The bill is limited to matters relating to health savings accounts.
Can I respond to the gentleman from Florida?
Yeah, you can. I've already ruled on it.
He's the one that put the protest in. I want to respond. I have that right in
You can
America.
respond, Mr. Pascrell.
Good. If this amendment isn't germane, nothing's germane. We're not germane. The base bill is supported about reducing the tax burden on those struggling to afford health care. I gave that specific example. My amendment provides urgent tax relief to Americans trying to pay one of their most basic bills. Get to basics. I've served on the committee for a long while. Maybe you think too long. I'm still here. Members have historically been granted wide latitude to raise a range of concerns during markups. You don't want me to read the litany. I got 2 sentences. We're talking about taking a vote on a Republican proposal to lower taxes for middle-class families. That's what I'm all about. I read one of your speeches 5 years ago, and you were the same thing. You said the same thing. If the other side refuses to vote on my amendment, I want them to explain why to each of their Republican colleagues and millions of Americans. And I am going to introduce another amendment if you rule this out of order. Thank you, Mr. Chairman, for your courtesy.
The amendment is not germane, the point of order is sustained, and the amendment is not in order.
Mr. Chairman? is it in order that I introduce my amendment now?
We'll recess right now to go vote, and then we will start back after our 33 votes. And if we're not done by the next vote series, we'll start back after that vote series. So thank you all. Committee room come to order. Are there any further amendments? Ms. Chu.
Mr. Chairman,
Yes.
I reserve a point of order.
Yeah, Mr. Chair, I wish to offer an amendment.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentle lady to suspend while the clerk distributes. Proceed.
Mr. Chair, I've raised this issue in our committee before, but it bears repeating. The state of reproductive and sexual health care in this country is at a crisis point. In the United States, the maternal mortality rate is increasing, and we know that it's even worse for women of color. And with the Supreme Court's decision to overturn Roe v. Wade, millions of American women live in areas without access to the full range of reproductive health care. In fact, 1.7 million American women of reproductive age live in a county that has neither access to abortion care nor maternity care. Frankly, this is untenable, and we in Congress should be taking every opportunity we have to expand protections for sexual and reproductive health care for all patients. The bills before us today aim to address the extraneous costs of procuring health care in the United States through the use of health savings accounts. In a world of patchwork state coverage, my amendment today will ensure that patients are able to use those same HSAs to cover costs associated with obtaining reproductive and sexual health care no matter where they live. For example, we know that thousands of people are traveling for abortion care in this country, and that type of travel comes with expenses. This could be lodging, childcare, gas, bus tickets, or plane tickets. And this was occurring even before the Dobbs decision, with research showing that 1 in 10 people obtaining an abortion in the United States traveled across state lines for care. Since Dobbs, these numbers have only increased. In fact, one study of Texans who sought abortion care after implementation of SB 8 but before Dobbs found that nearly half of those who went out of state for care traveled to neighboring Oklahoma, a state which now bans abortions, forcing Texans today to travel even further. My amendment would ensure that state laws in the wake of Dobbs would not interfere with HSA coverage of the broad swath of sexual and reproductive health care, including things like the medication used to stop the transmission of HIV and medication associated with miscarriage management. What's more, under current law, all plans are supposed to cover over-the-counter contraception, including emergency contraception. We know that doesn't happen, and no one should have to pay out-of-pocket for their birth control. But if there is an out-of-pocket cost, they should be able to use their HSA. The reality is that the overwhelming majority of Americans support a person's right to decide when and whether to start or expand their family. My amendment today is common sense. It would simply ensure that the costs associated with those decisions, be they over-the-counter contraception, travel, or other family planning medications, could be covered by a person's HSA, which is their own money, regardless of which state they live in. I urge my colleagues to join me in allowing patients to choose to spend their health care dollars on the costs that matter to them. I yield back.
Further discussion on the amendment. Ms. Sanchez.
Mr. Chairman, I wish to speak in support of Ms. Chu's amendment. I think the least that my Republican colleagues can do today is ensure that women's essential health services are protected by their bills. Ms. Chu's amendment ensures that these bills are not interpreted to prohibit anyone from using their health savings account funds from receiving reproductive care with, as she said, their own money. Currently, women are allowed to use their health savings accounts to pay for the full range of reproductive health services, notwithstanding state law. family planning, contraceptives, Plan B, abortion-related services, even feminine care products. These are all currently allowable services that you can pay for with your HSA. Ms. Chu's amendment shores up these protections in H.R. 5688. I'm not particularly hopeful that my Republican colleagues will vote to ensure that these critical services are protected. They proposed gutting Title X family planning program, and they voted against the right to contraception. They used the National Defense Authorization Act, a historically bipartisan bill, to attack servicewomen's access to abortion care. Republicans continue to show us where they stand on women's health. Democrats will continue to fight to protect women's access to the full range of reproductive care. And I hope that my colleagues across the aisle will agree to vote to protect these critical services for women. And I can't not emphasize enough that after all, HSAs are their own money. I yield back.
Further discussion on the amendment? Ms. Del Bene.
Thank you, Mr. Chairman. I speak in support of the amendment. From their first moments in the majority, House Republicans have been laser focused on taking reproductive rights away from Americans. One of the first measures brought to the floor was a bill that would add the threat of criminal litigation for healthcare providers who perform abortions. In nearly every government funding bill that House Republicans have proposed, they've included restrictions on reproductive health access, including for our service members. In my home state of Washington, we've taken steps to ensure patients are not subject to cost sharing for abortions and to legally protect healthcare workers who provide reproductive health services in the state. However, this is not the case across the country. This amendment would ensure that people who have health savings accounts can access the full range of reproductive health services, and I urge my colleagues to support it. I yield back.
Further discussion on the amendment? Seeing none, the question is on agreeing to the amendment offered by Ms. Chu. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Mr. Arrington? Mr. Arrington, no. Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Dr. Murphy, no. Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Fitzpatrick, no. Mr. Stubbe? Mr. Stubbe, no. Ms. Tinney? Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal? Mr. Neal, yes. Mr. Doggett? Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Davis? Ms. Sanchez? Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Del Bene? Ms. Del Bene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Ms. Moore, yes. Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Mr. Hearn? Mr. Hearn, no. Ms. Tinney? Mr. Doggett? Mr. Pascrell? Mr. Davis? Chairman Smith?
No.
Chairman Smith, no.
How is Mr. Doggett recorded?
Mr. Doggett is not recorded. Mr. Doggett, yes.
The clerk will report the vote.
The ayes are 16, the noes are 24.
There being 16 ayes and 24 noes, the amendment is not agreed to. Are there additional amendments? Mr. Kildee.
Thank you,
Chairman,
Mr.
I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentleman to suspend while the clerk distributes.
Gotta have these guys off the pass. Try to sneak through there.
Thank you. Proceed, Mr. Kildee.
Thank you, Mr. Chairman. It's hard to ignore the fact that as we sit here debating these bills, we're just 2 days away from a government shutdown, a shutdown caused by Speaker McCarthy's inability to govern and his constant capitulation to the most extreme voices in Congress. There is a bipartisan solution to keep the government open. All of us on this committee know that because virtually all of us supported it. The previously agreed to budget agreement, supported by over 300 Republicans and Democrats, but unfortunately, the Speaker walked away from that bipartisan agreement and has now brought us to the brink of a government shutdown that would be really bad, devastating for the people I represent in mid-Michigan, for the economy, for the workers, for those communities. The people I represent face the reality that come Sunday, vital nutrition assistance for over 200,000 Michigan mothers and children could be in jeopardy. Thousands of children would be without child care or early education opportunities. Our troops, our law enforcement officers, forced to work without pay. And here we are debating other issues. The bill we're marking up today will add over $70 billion to the national deficit, giving more and more tax breaks to the wealthiest Americans. This, of course, after Republicans and former President Trump passed a $2 trillion tax cut in 2017, which disproportionately benefited the top 1%, the wealthiest people in the country. And again, putting $2 trillion on the nation's credit card to give millionaires and billionaires a tax break. And that's what we should try to avoid doing again here today. I've heard claims that expanding the use of health savings accounts will help middle-class Americans manage their health care costs, but unfortunately, the data that we've heard just does not bear that argument to be true. Current data suggests that only 4% of all health savings account contributions are from households with incomes below $50,000, while 77% come from households with incomes over $100,000. Of course, that means that health savings accounts and the high deductible health plans that go along with them do very little, anything, for the families that I represent. Instead, they don't decrease medical debt or increase access to affordable care. They simply reward those at the top. And that's not the case in the event of these health savings accounts. Investment advisors, and we've heard Mr. Doggett explain this in great detail, investment advisors recognize that these triple tax advantage accounts are incredibly lucrative and are now marketing them to high wealth individuals, not as health care vehicles, but as retirement opportunities, retirement savings opportunities. They can't only be restricted to be used for health expenses, but also for home renovations, for yachts, for vacations, all at a tax advantage. And that's not right. It's not fair. It's not the intent of health savings accounts. Everyday Americans should not be paying for additional tax breaks for the wealthy. And so that leads to this amendment. I offer an amendment that's quite simple. It says that Americans making over $400,000 a year can't reap the benefits of a health savings account. We ought to focus these particular tax breaks on the middle class who actually need the help being able to afford health care for themselves and their families. I urge my colleagues to support my amendment, and I yield back.
Mr. Smith is recognized.
Thank you, Mr. Chairman. I certainly am opposed to this amendment. We didn't have ahead of time necessarily, but it was quite predictable nonetheless. We know that HSAs are available to all Americans, and it actually empowers patients, as we discussed earlier, to be in control. These accounts have the biggest net impact on the lives of hardworking middle-class families. Arguments made that we just heard are, I would characterize as posturing more than anything. But let's take a look at the so-called Inflation Reduction Act, which was the top priority of Democrats at the last Congress. In addition to a $7,500 tax credit for luxury EVs, emphasis luxury, their bill included tax credit giveaways to wealthy families who invest in Green New Deal home upgrades. The original price tag for that spending spree was originally $36 billion, and now JCT tells us the cost is up nearly 40% to $50 billion. So keep in mind that when you do the math on this, that someone who owns a multi-million-dollar home, this could be tens of thousands of dollars in government tax credit handouts. So certainly I hope my colleagues will join me in rejecting this amendment, and certainly the broken arguments supporting the amendment. Thank you. I yield back.
Further discussion on the amendment? Mr. Byer.
Thank you, Mr. Chairman. I'd like to yield some time to my friend, Mr. Kildee.
Thank you, Mr. Byer. I appreciate my friend's comments. I think we disagree fundamentally on the issue, but I just want to correct one aspect of it. And I recall with great detail the debate over those provisions included in the Inflation Reduction Act. And I just remind folks that there was a cap placed on the price of vehicles. It wasn't for all luxury vehicles. There was a cap placed on the amount of the vehicle. But interestingly, and more to the point, the amendment that I offer today, which would cap the income levels for individuals that would be eligible for this particular tax benefit, is similar to what was urged by my Republican colleagues as it related to some of the provisions of the Inflation Reduction Act, that not everyone should benefit, but only those people who are middle and lower income individuals ought to benefit. You took that position and held it very firm, and actually we agreed with you and included provisions that put income caps on the ability to access some of those provisions in the Inflation Reduction Act. If you thought it was a good idea for that legislation, I welcome your support as it applies to this legislation. I yield back.
Further discussion on the amendment? Seeing none, the question is on agreeing to the amendment offered by Mr. Kildee. The clerk will call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. LaHood? Dr. Winstrup? Mr. Arrington? Dr. Ferguson. Dr. Ferguson, no. Mr. Estes. Mr. Estes, no. Mr. Smucker. Mr. Smucker, no. Mr. Hearn. Mr. Hearn, no. Mrs. Miller. Mrs. Miller, no. Dr. Murphy. Dr. Murphy, no. Mr. Kustoff. Mr. Kustoff, no. Mr. Fitzpatrick. Mr. Fitzpatrick, no. Mr. Stubbe. Mr. Stubbe, no. Ms. Tinney. Mrs. Fishbach. Mrs. Fishbach, no. Mr. Moore. Mr. Moore, no. Mrs. Steele. Mrs. Steele, no. Ms. Van Dyne. Ms. Van Dyne, no. Mr. Feenstra. Mr. Feenstra, no. Ms. Maliotakis. Ms. Maliotakis, no. Mr. Carey. Mr. Carey, no. Mr. Neal. Mr. Neal, yes. Mr. Doggett. Mr. Doggett, yes. Mr. Thompson. Mr. Thompson, yes. Mr. Larson. Mr. Larson, yes. Mr. Blumenauer. Mr. Blumenauer, yes. Mr. Pascrell. Mr. Pascrell, yes. Mr. Davis. Mr. Davis, yes. Ms. Sanchez. Ms. Sanchez, yes. Mr. Higgins. Ms. Sewell. Ms. Sewell, yes. Ms. Delbene. Ms. Delbene, yes. Ms. Chu. Ms. Chu, yes. Ms. Moore. Ms. Moore, yes. Mr. Kildee. Mr. Kildee, yes. Mr. Byer. Mr. Byer, yes. Mr. Evans. Mr. Evans, yes. Mr. Schneider. Mr. Schneider, yes. Mr. Panetta. Mr. Panetta, yes. Mr. Schweikert. Mr. Schweikert, no. Mr. LaHood. Mr. LaHood, no. Dr. Winstrup. Dr. Winstrup, no. Mr. Arrington. Mr. Arrington, no. Ms. Tinney. Mr. Higgins. Mr. Higgins, yes. Chairman Smith.
No.
Chairman Smith, no.
The clerk will report the vote.
The ayes are 18. The noes are 24.
There being 18 ayes and 24 noes, the amendment is not agreed to. Are there additional amendments? Mr. Pascrell.
Mr. Chairman, I reserve a point of order.
A point of order has been reserved. The clerk will distribute the amendment, and I ask the gentleman to suspend while the clerk distributes.
Thank you, Mr. Chairman. Mr. Chairman, I think it's good to inject where I just was, and I'm late, and I apologize for that. I went to the opening of a movie because I'm chair of the Italian Americans in the Congress, in the House, and the Senate. The movie was put together, produced by Mr. Zach Zappo. Great movie about how Italians were interned during the Second World War. It's been a secret. It's been a secret. Joe DiMaggio's mom was one of those. If you were born in Italy and you came to the United States, you were interned. You were put in a camp. You say, well, what the heck does that got to do with health care? Very little. But it's about America. It's about this great country. So I don't understand, and of course, wisdom comes late, that Republicans do not want to vote on their own colleague's bill. I'm not trying to be a wise guy here. I'm telling you as it is. This is a slap in the face to middle-class Americans from across America. Let me remind everybody that middle income in New Jersey, New York is not the same as most of America. The numbers are the numbers. I mean, the guy from Arizona, gentleman from Arizona, he likes to talk about charts. Take a look at the numbers. If I'm wrong, tell me I'm wrong. But I'm never wrong on the numbers. Housing costs in New Jersey are 31% higher than the national average. I remember one of the members of the other side, who I deeply respect, said, why don't you have problems with this SALT thing because your governments don't operate properly. Oh, really? Oh, really? SALT is what that's all about. More people, more problematic things. You do your best whether you're a mayor. And I was a mayor. A lot of Democrats and Republicans were mayors. More should have been. Because you can't hide behind a desk when you're a mayor. They'll come and get you. Our states are the pack mules of the tax system. One of my brothers from New Jersey puts it this way, that we fund the country. He made some remarks about the fact that we're helping the poorer states. Many of them are in the South. Republicans targeted certain states when they passed their first tax scam. That really worked. A $2 trillion tax cut, that's what it cost. They didn't pay for much of it, except they used the SALT in order to pay for this tax cut, and they got slaughtered in the next election. Just the facts. You interpret them as you want to interpret. And we were targeted. There's certain states when they passed their first, I called it a tax scam. I don't mean anything vicious or anything by that, but it was, you screwed up your numbers. And then you bragged about it. In these states, even taxpayers in lower income brackets were impacted by the cap. So households surviving off retirement income, and I got the numbers. I didn't come here to jazz you up with numbers today. We all got numbers. We all got charts. Charts. Retirement income or experiencing unemployment may face sky-high property tax bills, Mr. Chairman. That's a fact of life. My amendment is simple. Until the Treasury Secretary certifies the cap doesn't raise taxes on Americans with less than $50,000 in income, the underlying bill cannot take effect. So, I'll be quick. If Republicans want to pass their unfunded tax break for the super wealthy, we need answers on the punishing impact of the SALT cap. I urge support of the amendment. I ask you to look twice, Mr. Chairman. Look twice. It doesn't spoil your agenda.
Your time has expired.
Thank you, Mr. Speaker.
Are there further discussion on the amendment? Seeing none. The question is on agreeing to the amendment offered by Mr. Pascrell. Clerk, please call the roll.
Mr. Buchanan?
No.
Mr. Buchanan, no. Mr. Smith of Nebraska? Mr. Kelly? Mr. Kelly, no. Mr. Schweikert? Mr. LaHood? Dr. Winstrup? Mr. Arrington? Mr. Arrington, no. Dr. Ferguson? Mr. Estes? Mr. Smucker? Mr. Smucker, no. Mr. Hearn? Mrs. Miller? Mrs. Miller, no. Dr. Murphy? Dr. Murphy, no. Mr. Kustoff? Mr. Kustoff, no. Mr. Fitzpatrick? Mr. Fitzpatrick, no. Mr. Stubbe? Mr. Stubbe, no. Ms. Tinney? Mrs. Fishbach? Mrs. Fishbach, no. Mr. Moore? Mr. Moore, no. Mrs. Steele? Mrs. Steele, no. Ms. Van Dyne? Ms. Van Dyne, no. Mr. Feenstra? Mr. Feenstra, no. Ms. Maliotakis? Ms. Maliotakis, no. Mr. Carey? Mr. Carey, no. Mr. Neal?
Yes.
Mr. Neal, yes. Mr. Doggett?
Present.
Mr. Doggett, present. Mr. Thompson? Mr. Thompson, yes. Mr. Larson?
Yes.
Mr. Larson, yes. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell?
Yes.
Mr. Pascrell, yes. Mr. Davis?
Yes.
Mr. Davis, yes. Ms. Sanchez?
Aye.
Ms. Sanchez, yes. Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Delbene? Ms. Delbene, yes. Ms. Chu? Ms. Chu, yes. Ms. Moore? Ms. Moore, yes. Mr. Kildee? Mr. Kildee, yes. Mr. Byer? Mr. Byer, yes. Mr. Evans? Mr. Evans, yes. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Mr. Smith of Nebraska? Mr. Smith of Nebraska, no. Mr. Schweikert? Mr. Schweikert, no. Mr. LaHood? Mr. LaHood, no. Dr. Winstrup? Dr. Winstrup, no. Dr. Ferguson? Dr. Ferguson, no. Mr. Estes? Mr. Estes, no. Mr. Hearn? Mr. Hearn, no. Ms. Tinney? Chairman Smith?
No.
Chairman Smith, no.
The clerk will report the vote.
The ayes are 17, the noes are 24, one present.
There being 17 ayes, 24 noes, and 1 present, the amendment is not agreed to. Are there additional amendments? Seeing none, the question is on the adoption of the amendment in the nature of a substitute. All those in favor signify by saying aye.
Aye.
Those opposed say no.
No.
In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I will now recognize.
Roll call vote, please.
On that one?
On the final passage.
Okay, yeah, we'll do that. I will now recognize Mr. Buchanan for the purpose of offering a motion.
Yeah. Mr. Chairman, I move the committee favorably reports H.R. 5688 as amended to the House of Representatives.
The question is on the motion to favorably report H.R. 5688 as amended to the House of Representatives. The clerk will call the roll.
Mr. Buchanan?
Yes.
Mr. Buchanan, yes. Mr. Smith of Nebraska? Mr. Smith of Nebraska, yes. Mr. Kelly? Mr. Kelly, yes. Mr. Schweikert? Mr. Schweikert, yes. Mr. LaHood? Dr. Winstrup? Mr. Arrington? Mr. Arrington, yes. Dr. Ferguson? Dr. Ferguson, yes. Mr. Estes? Mr. Smucker? Mr. Hearn? Mr. Hearn, yes. Mrs. Miller? Mrs. Miller, yes. Dr. Murphy? Dr. Murphy, yes. Mr. Kustoff? Mr. Kustoff, yes. Mr. Fitzpatrick? Mr. Fitzpatrick, yes. Mr. Stubbe? Mr. Stubbe, yes. Ms. Tinney? Mrs. Fishbach? Mrs. Fishbach, yes. Mr. Moore? Mrs. Steele? Mrs. Steele, yes. Ms. Van Dyne? Ms. Van Dyne, yes. Mr. Feenstra? Mr. Feenstra, yes. Ms. Maliotakis? Ms. Maliotakis, yes. Mr. Carey? Mr. Carey, yes. Mr. Neal? Mr. Neal, no. Mr. Doggett? Mr. Doggett, no. Mr. Thompson? Mr. Thompson, no. Mr. Larson? Mr. Larson, no. Mr. Blumenauer? Mr. Blumenauer, yes. Mr. Pascrell? Mr. Pascrell, no. Mr. Davis? Mr. Davis, no. Ms. Sanchez? Ms. Sanchez, no. Mr. Higgins? Mr. Higgins, no. Ms. Sewell? Ms. Delbene? Ms. Delbene, no. Ms. Chu? Ms. Chu, no. Ms. Moore? Ms. Moore, no. Mr. Kildee? Mr. Kildee, no. Mr. Byer? Mr. Byer, no. Mr. Evans? Mr. Evans, no. Mr. Schneider? Mr. Schneider, yes. Mr. Panetta? Mr. Panetta, yes. Ms. Sewell is not recorded. Ms. Sewell, yes. Mr. LaHood? Mr. LaHood, yes. Dr. Winstrup? Dr. Winstrup, yes. Mr. Estes? Mr. Estes, yes. Mr. Smucker? Mr. Smucker, yes. Ms. Tinney? Mr. Moore? Mr. Moore, yes. Chairman Smith.
Yes.
Chairman Smith, yes.
The clerk will report the vote.
The ayes are 28, the noes are 14.
There being 28 ayes and 14 noes, the motion is agreed to and H.R. 5688 as amended is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical and conforming changes to H.R. 5688 and that members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is H.R. 5687, the HSA Modernization Act of 2023. I will now recognize the gentlewoman from Texas, Ms. Van Dyne, for purposes of an opening statement.
Thank you, Mr. Chairman. In a time when health care is more expensive than ever, it's essential that we take proactive steps to improve accessibility, affordability, and effectiveness. And by helping individuals set aside their tax-free income for medical expenses, they're able to personalize their health care to better suit their personal needs while keeping up with the rising cost of medical care and skyrocketing insurance deductibles, which have, by the way, tripled since 2010. By cutting red tape, we are empowering individuals to make informed decisions about their health, which is why I am proud to lead the HSA Modernization Act, which includes 9 different improvements to HSAs to bring them into the 21st century, putting more Americans in charge of their dollars and decisions. This package includes my bill, the Elevating HSA Limits Act. This important bill raises contribution limits, removes restrictions set in place that would give Americans the ability to put more money into their HSA accounts. This common sense change will align contribution limits with what Americans are expected to pay out of pocket with an HSA plan. With families grappling with effects of inflation, they need and deserve to be able to save more and be in charge of their own money. Currently, 56% of employees offer high deductible plans, with 78% of all HSA account holders having an annual household income of less than $100,000, and more than half of all HSA accounts have a balance of less than $500. The average income of these people are less than $78,000. So far from what we've heard that this is going to benefit the rich, we're looking at families making an average income of less than $78,000. With nearly 72 million individuals utilizing an HSA, Washington needs to get out of people's wallets and put them back in the driver's seat. I would like to enter into the record this letter of support by the Employers' Council on Flexible Compensation. Mr. Chairman, I seek unanimous consent to enter into the record the letter of support for the Employers' Council on Flexible Compensation.
Without objection.
I want to thank my colleagues who are leading bills in this package, which will cut red tape, remove archaic restrictions on seniors, Native Americans, and veterans, and lastly, expand HSA access to Americans facing high out-of-pocket costs on the Obamacare market. I'm glad we're taking up this bill today to modernize HSAs and remove outdated restrictions. I thank all my colleagues and urge support of this legislation. Thank you, Mr. Chairman, and I yield back.
Thank you. I will now recognize Ranking Member Nill for his opening statement.
Thank you, Mr. Chairman. I'm going to yield to Mr. Doggett.
This bill suffers from all the shortcomings of the bill upon which we just voted. It is tax avoidance masquerading as health reform. It will add, its main difference with the prior bill is that we'll add even more to the national debt since it is an unpaid tax expenditure. As for who it helps, just a reminder that only 5% of the people earning less than $100,000 in income report having ever made a penny in contribution to their HSA. The statistics being used to justify this bill are without merit, and I hope it will be rejected. I yield back.
Thank you. The committee will now proceed to consideration of H.R. 5687, the HSA Modernization Act of 2023. Without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance along with a green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of amendment. I will now turn to Tom Bartold, Chief of Staff for the Joint Committee on Taxation, to provide the technical description of the tax provisions in the amendment in the nature of a substitute with an emphasis on the changes made since introduction. I ask the members hold their questions until after his presentation. Mr. Bartold.
Thank you, Mr. Chairman. The members have before them 3 Joint Committee documents, JCX 41, 42, and 44, which describe the underlying legislation, the chairman's amendment, the nature of a substitute, and provide the Joint Committee staff's estimates of the budgetary effects of these proposals. As general background, an individual can contribute to a health savings account only if they have a high deductible health plan and are not covered by any other health plan providing benefits that are covered by the high deductible health plan. H.R. 5687 makes two types of changes. It clarifies or modifies the benefits an individual may receive and still have his or her high deductible health plan qualify him or her to make contributions to a health savings account. For example, the changes to the Indian Health Service benefits. It also makes changes to the rules that affect the timing and the amount of contributions that qualifying individuals may make to health savings accounts. The chairman's amendment in the nature of a substitute makes necessary clerical changes. The provisions of this legislation are generally effective after calendar year 2025, and the staff of the Joint Committee on Taxation has estimated that the budgetary effects for the fiscal year period 2024 through 2033 is a revenue loss relative to baseline receipts of $58.3 billion. That concludes my brief overview of the legislation. I'd be happy to answer any questions that the members might have.
Thank you. Are there any technical questions about the amendment in the nature of a substitute? Seeing none, we will move to strike the last word. Does anyone wish to strike the last word? Mr. Smith. Oh. Ms. Maliatakis.
Thank you, Mr. Chairman. It's great to see that this committee is taking up this legislation today that would give more choice and flexibility in healthcare spending by expanding HSA eligibility to more Americans. HSAs were created to put more people in the driver's seat when it comes to their healthcare spending and decisions. However, certain patient populations, such as working seniors, veterans, Native Americans, and others are currently unable to access tax-advantaged healthcare dollars. That's why I'm pleased to see that the legislation that my colleague Michelle Fischbach and I introduced, included in H.R. 5687, the HSA Modernization Act. Our legislation would allow working seniors who are enrolled in Medicare Part A to continue to contribute to an HSA provided by their employer plan. Currently, seniors who continue working past age 65 who take advantage of Medicare enrollment in Part A and have the means to continue contributing to their HSAs are prohibited from doing so due to current HSA plan rules. Today, seniors aged 65 to 69, past the standard retirement age, are actually more likely to have a job than teenagers. A full 32% of these post-retirement age seniors have jobs, up from less than one quarter in the year 2000. With people working longer into their golden years, HSAs need to catch up with the times, and that's exactly what our bill resolves. Thank you, and I yield back.
Thank you. I recognize Mr. Stubbe to strike the last word.
Oh, he doesn't want to anymore. Okay, Mr. Smith.
All right. I recognize Mr. Smith to strike the last word. Mr. Smith of Nebraska.
Thank you, Mr. Chairman. Obviously, these packages we're marking up today are important steps to help the needs of the American people, especially their health care. It's common that I hear from constituents that they struggle to afford the growing costs of health care, and I think these pieces of legislation today, especially this one, another one with health savings accounts, offers tools for the American people that they need. It includes, for example, the bipartisan Native American Health Savings Improvement Act, which I introduced with several colleagues earlier this month. This bill removes unnecessary restrictions on contributing to an HSA for Native Americans who access health care through the Indian Health Service, or IHS. I also recently introduced bipartisan legislation, which is included in Section 10 of today's HSA Modernization Act, to clarify that long-term care needs are included in the definition of the, quote, qualified medical expenses, end quote, for which HSAs are eligible to cover. This change makes it clear HSAs can be used to ensure chronically ill patients who struggle with tasks of daily living can use their HSA to cover home care services such as assistance with eating, toileting, transferring, bathing, dressing, and continence, as long as those services are provided under a plan of care prescribed by a licensed healthcare practitioner. While the changes we are making today are big steps in modernizing HSAs, I hope we continue to improve these accounts while looking at what additional services or products may be appropriate additions to the list of qualified medical expenses. One example is broadening the definition of what home care services can be paid for with HSAs. I hope that my colleagues will support this bill, and I yield back the balance of my time.
Thank you, Mr. Smith. I now recognize Mr. Feenstra to strike the last word.
Thank you. I'm glad that my bill, the Native American Health Savings Account Act, is moving forward. It's being included in this HSA Modernization Act of 2023 that I've worked on with many of my colleagues. The HSA Modernization Act removes needless obstacles preventing more use of HSAs. For instance, there is no reason that Native Americans should wait 3 months to contribute to their HSAs after going to an IHS facility for medical care. This bill will correct that problem and allow for patients to start saving immediately. I am proud to be an original co-sponsor with Congressman Molinar's bill and urge my colleagues to support this much-needed HSA modernization to promote health savings for Native Americans across this country. Thank you, and I yield back.
Thank you. I now recognize Mr. Carey for 5 minutes.
Mr. Chairman, I move to strike the last word. My bipartisan common sense bill, the Veterans HSA Access Act, which is included in the HSA Modernization Act, would allow veterans who receive health services through the Department of Veterans Affairs to continue to contribute to HSAs. I am grateful that fellow veteran Representative Jared Golden of Maine, who is a Marine Corps vet, joined me in introducing this important legislation. My bill has been endorsed by Concerned Veterans of America, the HSA Coalition, the Employers Council on Flexible Compensation, and the American Benefits Council. Look forward to supporting this important legislation, which expands HSA eligibility to populations such as working seniors, veterans, Native Americans, and others who are currently prevented from accessing tax-advantaged health care dollars. Mr. Chairman, I would also like to request unanimous consent to submit 2 letters of support of our bill into the record, one from the HSA Coalition and the other from the Employee Council on Flexible Compensation.
Without objection, so ordered.
I yield back.
Thank you. And now I recognize Ms. Van Dyne for 5 minutes.
Thank you very much, Mr. Chairman. I'm hearing complaints that this bill is too expensive, that we're going to be losing revenues. Our colleagues' memory is very short. Last year they forced through $271 billion in tax breaks for Green New Deal spending. Now JCT tells us the price tag has more than doubled to $650 billion, and much of that is going to the wealthy and to large corporations. And I'd like to introduce, for the record, this JCT report showing that 30% of households making over $1 million are getting a tax cut of over $500. This is hypocrisy at its finest. We're also hearing that the only people who actually are able to participate with HSAs are the wealthy, upper class millionaires looking for another tax break. The fact is that charge is completely false. In fact, 78% of all HSA account holders have household incomes of less than $100,000, making HSA accounts far more common for lower class and middle class families. 62% of HSA account owners spend their accounts on health expenses each year, proving that these funds are being used for health care expenses now and not just saved away as tax shelters. HSAs are an important tool for working class families. Account holders making under $60,000 a year have an average HSA balance of $883, showing earners of all incomes are saving money to use for their healthcare expenses. The average household income, again, I had said this earlier in my comments, of Americans with HSAs is $78,000, proving they're for working class Americans. And these accounts empower patients to be in control, not one size fits all Washington programs. We sit here, it's almost like a game of hungry, hungry hippo in DC, where they're thinking that all dollars that are created are DC dollars or government dollars. Taxes are not revenues. This is a common misperception up here in DC. The government isn't earning these dollars, and they're taking them, and they're forcing hardworking families to fight to keep pennies on the dollar that they earned. It's outrageous, and it's a mindset that has to change. Encouraging Americans to put aside money for potential healthcare expenditures should not be viewed as a loss to Washington's bottom line. It's not Washington's money. Chairman, I yield back.
Thank you. Further members to strike the last word? See none, we'll move to amendments. Are there any amendments to the amendment in the nature of a substitute? See none. The question is on the adoption of the amendment in the nature of a substitute. All those in favor signify by saying aye.
Aye.
All opposed say no. No. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I will now recognize Mr. Smith for the purpose of offering a motion.
Mr. Chairman, I move that the committee favorably report H.R. 5687 as amended to the House of Representatives.
The question is on the motion to favorably report H.R. 5687 as amended to the House of Representatives. The clerk will call the roll.
Mr. Buchanan. Mr. Smith of Nebraska. Mr. Smith of Nebraska, yes. Mr. Kelly. Mr. Kelly, yes. Mr. Schweikert. Mr. Schweikert, yes. Mr. LaHood. Mr. LaHood, yes. Dr. Winstrup. Dr. Winstrup, yes. Mr. Arrington. Mr. Arrington, yes. Dr. Ferguson. Mr. Estes. Mr. Estes, yes. Mr. Smucker. Mr. Smucker, yes. Mr. Hearn. Mr. Hearn, yes. Mrs. Miller. Mrs. Miller, yes. Dr. Murphy. Dr. Murphy, yes. Mr. Kustoff. Mr. Kustoff, yes. Mr. Fitzpatrick. Mr. Fitzpatrick, yes. Mr. Stubbe. Ms. Tinney. Ms. Tinney, yes. Mrs. Fishbach. Mr. Moore? Yes. Mr. Moore, yes. Mrs. Steele. Mrs. Steele, yes. Ms. Van Dyne. Ms. Van Dyne, yes. Mr. Feenstra. Mr. Feenstra, yes. Ms. Maliotakis. Ms. Maliotakis, yes. Mr. Carey. Mr. Carey, yes. Mr. Neal. Mr. Neal, no. Mr. Doggett. Mr. Doggett, no. Mr. Thompson. Mr. Thompson, no. Mr. Larson. Mr. Larson, no. Mr. Blumenauer. Mr. Blumenauer, no. Mr. Pascrell. Mr. Pascrell, no. Mr. Davis. Mr. Davis, no. Ms. Sanchez. Ms. Sanchez, no. Mr. Higgins. Mr. Higgins, no. Ms. Sewell. Ms. Sewell, no. Ms. Delbene. Ms. Delbene, no. Ms. Chu. Ms. Chu, no. Ms. Moore. Ms. Moore, no. Mr. Kildee. Mr. Kildee, no. Mr. Byer. Mr. Byer, no. Mr. Evans. Mr. Evans, no. Mr. Schneider. Mr. Schneider, no. Mr. Panetta. Mr. Panetta, no. Mr. Buchanan. Mr. Buchanan, yes. Dr. Ferguson. Mr. Stubbe. Mrs. Fishbach. Chairman Smith?
Yes.
Chairman Smith, yes.
While we're waiting for additional members to come, I'd love for our committee to wish Carl Griffin happy birthday on his birthday. So, what a great way to spend your birthday. How is Ms. Fishbach recorded?
Mrs. Fishbach is not recorded. Mrs. Fishbach, yes.
How is Mr. Ferguson recorded?
Dr. Ferguson is not recorded. Dr. Ferguson, yes.
And the clerk will report the vote.
The ayes are 24, the noes are 18.
There being 24 ayes and 18 noes, the motion is agreed to, and H.R. 5687, as amended, is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical and conforming changes to H.R. 5687, and that members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. There being no further business before the committee stands adjourned.